Hello, everybody. Good morning. I'm so excited. I'm Genevieve Edwards and I'm Chief Executive of Bowel Cancer UK. And with me,
I'm Catherine Winsor and I'm Director of Services at Bowel Cancer UK.
So I'm really thrilled. It's my great pleasure to welcome everybody today to our first online virtual Living Well with Bowel Cancer event. And do you know, we've had over 170 people sign up for this event this morning, which is just incredible, absolutely incredible. And I know that many of you are not watching alone. You've got other halves, family, friends with you. So it's brilliant to have you all here today. And I guess first thing I want to ask is, how are you? How are you today? And I know that some of you have started to answer that question in the chat and to introduce yourselves. Which is absolutely brilliant. And I can see people saying that they're excited, stressed, anxious, all of those things. It's really important to be able to say, isn't it?
Absolutely.
Just acknowledge how we are.
We're quite stressed.
No, we're very calm. We've got this.
We have got this, but you know, there's anxiety there.
But we've got a really packed day ahead for you. And at the end of the day, I'm hoping that we are all going to feel better informed about how to live well with bowel cancer. But more important than that, and we've got some incredible speakers coming up who are real, like, top of their game, experts in their field, who've got some really first-hand, brilliant experience to share. And that's going to be great. But there's another benefit today, and that's that we all feel better connected to each other, no matter where you live. And I can see people from, Devon, Glasgow, Northern Ireland, all over the UK. But we are all part of that family, that Team Bowel Cancer UK family. So I hope that by the end of today, you feel better connected with each other as well, and also better able to cope, because living with bowel cancer is it's not an easy ride, is it? And you don't start out an expert. It's something that you learn how to live well with bowel cancer as you go along. And so hopefully you'll have picked up some tips today about living better with bowel cancer. So this is actually part of our wider support services that we have to help people to really live well with bowel cancer, and it sits alongside their help and support that you'll be getting from the NHS. And I know that this is a really challenging time to be going through something like this on top of a pandemic. And some of those services that you might have expected to get through the health service could have been disrupted or suspended. So there's a number of things that we're putting in place just to keep people well informed, well connected, and supported during a really challenging time. So I'm not going to say any more because we've got so much lined up for you. You don't need to be hearing from me. And instead, I'm going to hand over to Catherine, who's going to expertly steer us through a packed agenda today.
I should do my best.
So I'm really looking forward to seeing any questions you have or any comments in the chat. I'll be keeping an eye on those, and so will our lovely Bowel Cancer UK team here. And we'll make sure that we get through as many of your comments and questions as possible. So welcome, everybody. Over to Catherine.
Lovely. Thanks, Jen. Thanks so much. Unbelievable to see how many people are already using the chat and telling us how they're feeling and where they are in the country. That's brilliant to read. And as Jen says, we can clearly see that you're coming to us from all over the UK. I'm not sure if anybody wants to make a bid for perhaps the furthest. I don't know, have we got anybody on an island anywhere, maybe? We know we've got somebody from Belfast, which is Irish.
Sandra from Northern Ireland as well.
Sandra, yeah. We've got anybody on the Isle of Wight or maybe Mull, or somewhere far flung? That would be good, wouldn't it?
Yeah.
So it's coming in from all over. So there is just a little bit of housekeeping that I need to run through. I get the boring bits to talk about today, as well as the fun bits. Isle of Wight, that's good.
Excellent.
That's what I like to see. So most of you have found the chat function, which is great, and keep talking to us throughout. We'll do our best to pick out the themes and the comments of what you're talking about throughout the day. There's also, on that bottom bar where the chat box function is, there's another button labelled, I think it says Q&A, and that's where we'd love you to put your questions for the panellists as they're talking. So during their slideshows, and we'll do our best to pull out as many of those questions as we can and answer them. We possibly won't have time to answer them all, but we will do our very best. to answer as many of them as we can. We're also recording today's event because we know that there are lots of people who haven't been able to join us today who would really like to be able to benefit from this event. So just to reassure everybody that your chat and your question comments don't show in the recording. So it's completely anonymous. Nobody will know that you're Suzanne in Fleet, for example.
Hi, Suzanne.
Hi, Suzanne, because that doesn't show on the recording. We will send you the link to the recording afterwards as well, so you too will be able to watch it again and perhaps share it with people around you who weren't able to join today. And there'll also be the dreaded feedback form that we'll send out next week. We really do ask that you take the time to give us your feedback on today's event. We want to know what worked, what we could do a bit better, and whether or not you've got suggestions for the future. And it's really important that we have your feedback, because that's the feedback, isn't it, Jen, that we use to bring in more funding to enable us to do more events like this. So please do give us your feedback when that form arrives.
Thank you.
Okay, so no one turned up here today to listen to me. So time to crack on with our first speaker. So our first speaker of the day is Dr. Darren Fernandes. Darren is a clinical fellow in gastroenterology at Lincoln County Hospital. I think I might have seen someone from Lincoln actually. Here's Darren. Darren's joined us.
Darren.
Morning, everyone.
Is a real first for me because I've never met anyone who's met an astronaut. And according to Darren's biography, I think Darren might have met a few astronauts working at the European Astronaut Centre. But sadly for me, Darren, you're not here to talk to us about astronauts and all things astronaut related, but you are here to talk to us about coping with the side effects of bowel cancer. So Darren, I'm going to welcome you and hand over.
Indeed. Thank you. Thank you for inviting me to this great talk today. So as I've been introduced, I'm Darren. I'm a research fellow at Lincoln, and I work with Professor Jarvis Andreev, who's a gastroenterologist, and we specialize in managing patients who develop symptoms following cancer treatments. Now, what I'm going to talk to you all today is about some of the common problems we see in patients who've been treated for bowel cancer and how we manage these issues, and also later on go into discuss ways in which you can manage problems too. So just see if my slideshow's working. So the number of patients living post a cancer diagnosis for all cancer types is increasing. And as we can see from this data in 2015, colorectal or bowel cancer accounts for the third largest number of patients now. And what this really equates to is nearly a 50% reduction in mortality since the 70s, and a more than doubling in survival over the past 40 years. And this trend will continue to grow due to better screening programs and better treatments. Now, this diagram illustrates that bowel cancer can affect any part of your bowel and rectum. And this is important because it influences the type of treatments you may receive, and also the side effects that one goes on to develop. So at this moment, I'd just like to run a poll to see how many of you have developed side effects following treatment and whether or not you've been referred to a specialist. So we'll give you about half a minute to answer these questions, and then hopefully I'll be able to continue with the presentation. We'll come back to the results later. So am I able to move on? Right, so at Lincoln, last year we set up a specialist clinic to manage patients who've been treated for bowel cancer, but developed problems following treatment. And we've been able to do this through funding received from the East Midlands Cancer Alliance. So as you can see, we've treated patients who've been diagnosed with cancer in various parts of their bowel and their rectum. And they've also received a variety of different treatments. The majority will have received surgery, but we've also got patients who've had radiotherapy, chemotherapy, or a combination of all three. But when patients come to our clinic, we're not only inquiring about the bowel symptoms that they may have, we're also interested in other symptoms such as urinary dysfunction, sexual dysfunction, or issues with their moods where they may feel anxious or low. And we commonly investigate our patients systematically so that we rule out all the common causes for the problems that they may have. And we prescribe treatments according to a flowchart. So if one therapy doesn't work, we can move on to the next. And by doing this, we're able to ensure our patients receive tried and tested treatments to improve their symptoms. Finally, what's unique about our clinic is that we get patients to fill in questionnaires to report back to us how the interventions have worked. So we get a really objective understanding of how effective our management plans are. Now, typically, our patients have a variety of different symptoms. The majority will have loose stool or diarrhea, urge, which is the need to go there and then, or frequency, going multiple times in a day, and some may also have bloating and winds that can cause a lot of discomfort. Occasionally, patients may have incontinence or have accidents where they pass stool unknowingly, or have mucus discharge or pain. And these symptoms commonly represent a treatable problem. Now, the most common diagnoses we see in our patients are as follows. The first is bile acid malabsorption. Now, bile acids are released from your gallbladder and they get sent into your small intestine, which is this area here. Here they break down fat in food so that it can be digested. Any bile acids that remain end up in your large intestine, and usually they're reabsorbed and sent back to your gallbladder so that that process can restart. However, in patients who've had radiotherapy, or say you've had part of your right bowel removed, the reabsorption doesn't occur, and so bile acids continue to travel through your large intestine. As they do this, water gets drawn out, and you may have watery diarrhea. Some patients go 10 to 15 times a day when they have this. Now, we can easily diagnose bile acid malabsorption by performing a specialized scan called a CCAT scan, and this is available in most hospitals. If this confirms the diagnosis, we give patients a treatment with either a powder or a tablet that mops up all these excess bile acids, and we see a significant improvement in patient symptoms. Another common cause we see is constipation. Now, we often think of constipation as the inability to go to the toilet for several days, or passing very hard stool and straining. However, we frequently see the opposite in patients who've been treated for bowel cancer. So our patients often describe going multiple times in a day, but each time that they're going, they're not getting a complete bowel evacuation and don't feel very satisfied, so they go again. They may also find that they get leakage or loose stool, and so they mistakenly think this is diarrhea. They've therefore been taking medications like loperamide or Imodium for many years, but actually these medications aren't helping, and what they're doing is slowing down the bowels and worsening the constipation. We investigate our patients for constipation by performing either an X-ray or a scan, and if this shows a blockage of stool going throughout the bowel, then we give our patients bowel cleansing medication similar to what you would have had for your colonoscopy. And this clears out the bowels, and then we can start patients on regular laxatives, which keeps the movements regular. Another common diagnosis we see is bacterial overgrowth, or SIBO. Now, this has gained a bit more attention in the papers because patients with IBS have commonly been found to have bacterial overgrowth as a cause for their symptoms. If we go back to my diagram, bacteria are found both in your small intestine and your large intestine. However, the number of bacteria is relatively low in your small intestine, whereas in your large intestine, there's an extremely high number of bacteria. Now, this is influenced by when patients have treatment for bowel cancer with radiotherapy or surgery. And so bacteria can start to move from your large intestine and start to multiply and overgrow in your small intestine. When this happens, you may experience bloating, wind, discomfort, and may also have loose stool or constipation, and a whole load of other symptoms. Commonly, when patients are investigated, they're told they have IBS. But actually, if we perform a breath test, this may show that there's an excess of bacteria which is leading to this. And so we give patients a course of antibiotics, which reduces the number of bacteria in the small bowel and has a dramatic improvement in symptoms too. Other common things we see in our patients is a lack of pancreatic enzymes, also known as pancreatic insufficiency. So again, when we eat, our pancreas produces juices which contains enzymes or proteins to break down fats. In some cases, this mechanism doesn't always work, and so patients end up having diarrhea again because they're not digesting fat properly. We diagnose this condition by performing a stool test, and this can be done even by your GP. If this confirms a lack of pancreatic enzymes, we can give you supplements to have with your foods. And again, this can improve symptoms. Finally, we don't always find the cause for why patients are having symptoms, but when we delve deeper into the history, we find that they may be having more alcohol than they usually would. This has been especially true over the lockdown periods, where patients may have unknowingly been having more alcohol throughout the evening. Now, it's important to realize that we usually recommend patients have no more than 14 units of alcohol a week. And when you're having more than this not only has effects on the rest of your body, but can also affect your bowel by causing loose stool or diarrhea. So those were some of the common things that we see in our clinic. And really, if you have any of the symptoms I've mentioned, it's important that you seek specialist referral so that you can be investigated for these. But there's also ways in which you as patients can help yourself too. So the first is to perform regular pelvic floor exercises. Now, after surgery especially, the pelvic floor muscles become weak. However, you're doing regular pelvic floor exercises, and there are a number available online and videos as well on how to do this, then you're strengthening these muscles. And this helps you to hold on to stool when you get an urge to go. It also prevents leakage and allows you to pass a stool more effectively when you do go to the toilet. We also give our patients information on toileting exercises. So we ask them to adopt the brace position or the squatting position. Now, generally, when we sit on the toilet, we're normally causing a kink in our rectum. And so this performs a blockage or barrier to getting stool out effectively. However, by adopting the brace position as shown here, by using a footrest, we're able to relax the muscle in our bottom so that kink goes and stool can pass out more easily. Now, you can purchase footrests like the Squat Easy from places like Amazon. It costs about £15. And this is a really effective way of being able to open your bowels without needing to strain. A lot of my patients often say that they can't go out or do things because they're afraid of needing to know where a toilet is and get to a toilet in time. Now, there are really useful apps like Toilet Finder that can help with this. So this is downloadable from the App Store or Android. And what you do is type in a postcode or a place of interest, and it will give you a location of various public toilets that are nearby. So it allows you to plan ahead should you need to go to a toilet when you're out. There's also the radar key, and this is purchasable from many retail stores, including Boots. And this key gives you access to any locked public toilets. And finally, some patients find having a change of clothes, a wash kit, or some extra pads can be beneficial, especially for times when you may unfortunately be caught out. Now, another symptom our patients frequently describe having is fatigue. And there are a number of reasons for why patients who've been treated for bowel cancer develop fatigue. So of course, the first is the treatment. When you've received radiotherapy or chemotherapy especially, these can have effects on other major organs such as your heart or your lungs. Also, a cancer diagnosis is a life-changing event, and patients often feel anxious about what the future holds. If you've had surgery and are left with either a stoma, scar, or debilitating symptoms, you may feel very depressed or low in mood, and this can affect your sleep. Patients may also suffer pain as a consequence of treatment, and when patients have pain, they have a reduced appetite and so don't eat as much. And finally, when you've had parts of your bowel removed or been treated, you may have a lack of absorption of certain minerals or vitamins, and this can affect the blood levels. And also, if you're having diarrhea or loose stool, you can have altered salt levels or dehydration. Now, there are a number of ways in which we can treat fatigue and manage fatigue. And I've split this into non-medicinal and medicinal. So non-medicinal ways are firstly to conserve energy. So whenever you do an activity, you should balance this with a period of rest to allow you to recuperate. For those that may have anxiety or suffer with a low mood, counselling is a really effective way of managing these issues. It's important to get adequate sleep and follow good sleep hygiene. And a good way to do this is avoid having caffeinated drinks at least 4 hours before you go to bed, trying to go to sleep at a regular time each night, avoid watching TV, or as I do, using your phone to go through Instagram or Twitter as you're lying down, because again, this also affects the quality of your sleep as well. Yoga is another effective way, and I know there's a session on this later, and exercise, which I'll go on to speak in my next slides. And then there are medications which we can give to help. So the first is pain relief. Now, it's important if you are suffering with a lot of pain and you haven't been seen by a specialist, that again, you seek specialist help. There are a number of reasons why someone may develop pain. Those who've had radiotherapy may not get the effects of the radiation until years later. And so by being investigated, we can tailor the treatments that you receive. Iron supplements are helpful to boost iron and blood levels. For those that have diarrhea, medications like Diarrhea can be helpful. And finally, we have antidepressants like citalopram or sertraline to help boost the mood. Now, exercise is important regardless of how fit you are. And we all know the benefits of exercise on the heart and lungs and other parts of our body. But exercise also has benefits for your mood, the quality of your sleep, and overall the quality of life. Now, bowel cancer patients are often recommended to do 75 minutes to 150 minutes of vigorous exercise each week. But what is vigorous exercise? What Usain Bolt considers to be 75 minutes of vigorous exercise may be very different to what I consider to be 75 minutes of vigorous exercise. And so when I see my patients and speak to them, I break it down into how fit and active they are. So if you're very active, perhaps someone who goes to the gym a few times a week or goes for regular walks, then you should be doing at least 6 hours of walking or 3 hours of cycling a week to get the benefits of exercise. If you're less mobile, you should do at least 70 minutes of walking or 35 minutes of cycling each week. And if you're someone who's predominantly at home, you should reduce the amount of time you lie or sit down. So every few hours, get up from your seat and walk around your room. Or if you've got stairs, going up and down your stairs a few times each day. Diet and lifestyle is also important. I know our next talk is about this, so I won't dwell on this too much, but it's important to avoid processed meat and limit the amount of red meat due to the effects this can have with bowel cancer. It's also important you get a good amount of fiber into your diet, and fiber can maintain good bowel health because it forms a gel to help bowel or stool pass along, and also gives bulking to your stool too. However, you should monitor how much fiber you're having. Now, we recommend again that patients have about 30 grams of fiber each day, but this can be difficult to calculate. One way in which we help our patients to do this is to provide them with a fiber quiz. And this is an example of what they would do for breakfast. So based on what you eat, you give yourself points. And overall, throughout the day, we want our patients to score between 10 to 20 points. If you're getting more than 20 points, that would suggest you're having too much fiber. And when you have too much fiber, you may suffer with constipation, excessive wind, or bloating. And if you're getting less than 10 points, you're probably having too little fiber, and that can cause loose stool or leakage. It's also important to stay very well hydrated. So you should have at least 2 liters of water a day. And again, this helps to keep your stool very soft and it allows it to pass through more easily. For those that have stomas, you can, if you've got quite a loose output, you can thicken it by having ripe bananas, boiled rice, pasta or porridge. I've already mentioned about alcohol and the fact that you should try to avoid having any more than 14 units each week. Also, if you're still smoking, quitting smoking is very important, not only for your bowel health, but your overall health. And there are services on the NHS that can help with this. And also there are guides on the types of foods that you can eat that are available on the NHS website, as well as the Bowel Cancer UK website, which is as such. Finally, I'd like to talk about body image and sex. So a lot of patients, after they've been treated for bowel cancer, may either have a stoma or surgical scars, and this can affect their confidence and make them more self-conscious. The treatment that patients have can also affect the function of sexual organs. So in men, when you've had radiotherapy or surgery, that can affect your blood supply and nerve supply. So you have difficulty in getting erections. And in women who've had radiotherapy, you may find that your vagina becomes more dry or short and tight, and that can cause pain on intercourse. Now, we can give patients medications, men, to help achieve erections, such as pills, gels or implants. And in women, there are lubricants to help with dryness or dilators to reduce tightening. In more complex cases, we also are able to refer on to specialists. And it's important because it's not only bowel cancer patients who have these issues, but patients who've been treated for other cancers will also experience similar problems too, such as men who've been treated with prostate cancer or women who've been treated for cancers of the womb. It's also important to be open with your partner and to share what you're going through. Don't be embarrassed to discuss these issues with your specialist. I may be a gastroenterologist, but I'm not only interested in your bowel problems. And if you don't tell me about other issues that you have, I can't refer you on to get the help that you need. Finally, there's support available through organisations such as the College of Sexual and Relationship Therapists. So before I conclude, I just wanted to see if we could bring up the results of our poll to see how many of you have been seen by a specialist. So really, that's not surprising. We know a lot of patients do have symptoms following treatment, and a lot of patients do bring this up with whoever they see, but unfortunately, a lot of patients aren't being referred to get the help that they need. And this is something we're constantly trying to drive at our hospital and with our local GPs. And so the most important thing you can do as a patient is seek specialist help. We're here to help you, and it's no longer good enough that patients are living post the diagnosis of bowel cancer. We want our patients to also have a great quality of life. Thank you.
Thank you so much, Darren. That was a really fascinating presentation.
Wasn't it? I learned so much.
Yes, I took a photo of a slide to share with my dad, who needs to learn a little bit more about managing fatigue with exercise. So thank you. We've had some brilliant questions, actually, so I'm just going to dive in with a few of those. The one I'd like to start with is, Darren, do you have any thoughts on waves of nausea on a daily basis? Margaret says she has a healthy diet, doesn't drink. She had surgery and chemo over 6 months ago, but is still experiencing daily waves of nausea.
So again, Margaret, nausea can be caused by a variety of different things. It may be related to medications that you may be on. It could also be due to some of the problems I've mentioned earlier. So SIBO can commonly cause nausea, and perhaps that's something you need to be investigated further for. Again, sometimes we don't find the cause, and there are medications that we can also give to try and settle the nausea and to cope with that. So I think, again, I can't emphasize how important it is to seek specialist help.
That's great, thank you. And I think following on from that question, someone's asked, where do I get help from someone like Darren? What do I ask for? What's it called? So can you just give people some advice on how they find the Darren equivalent for them?
So yeah, so I think for the things that I've talked about, you can actually see any general gastroenterologist to be investigated for this. Unfortunately, there aren't many specialists who just focus on the side effects of cancer treatments. And this is something we really need to work on to raise awareness, because as I said, number of patients living post the diagnosis is increasing, but we're finding that the funding into living well post a treatment or consequences of treatment isn't there. And we really struggle to get specialists to manage these conditions. So I think joining organisations like Bowel Cancer UK to raise awareness is really helpful to do this. But just to answer that question, if you do have issues, you can speak to your GP, or if you've got a key worker who's a specialist nurse, ask them to refer you to a gastroenterologist, because they should be able to at least investigate you for the main problems that I've mentioned.
Brilliant, thank you. Thank you so much, Darren. Margaret, I hope that helps. We have another question here around fibre intake. So this person said they were told to reduce their fibre intake due to their tumours because one is slightly blocking their intestine, and they're assuming that that's why they were asked to reduce their fibre intake. Or should they increase their fibre intake? I think they're a bit confused as to which way they should be going.
Yeah, so again, if the patient has a tumour still present, then having too much fibre, as I said, can start to bulk your stool up, and that can cause a blockage or an obstruction. And of course, that's something we don't want to happen. So it's always very individualized as to what your overall condition is and how you are. And so again, speaking to a dietitian is helpful to know how much fiber you should have in case that affects the consistency of your stool based on what your clinical outcome is like as well.
That's great, thank you. I'm sure there's lots of people listening who are thinking, yes, that sounds like me. That's great advice. Mm-hmm. There's a question here from Mandy, which I am sure is going to resonate with a lot of people. She says she has a stoma. So does this make a difference to the advice that you would give around exercise and diet?
No. So again, with regards to diet and patients have stomas, again, patients may find that they still get symptoms such as bloating or wind, and that can be related to the food that you're eating in your diet. So sometimes it's helpful to keep a food diary to see if there are any specific foods that may be triggering those symptoms. We also see in some patients who have stomas and have symptoms that that could be related to bacterial overgrowth. And again, we can try to reduce that by giving some antibiotics to see if that helps. In terms of doing exercise with a stoma, you should be able to do most of the exercises that you normally were before. I think it's just important not to push yourself, especially if you're someone who does weights, because sometimes putting excessive pressure within the abdomen can put your stoma at risk. And so it's just important not to push yourself too much and know your limits.
I think know your limits applies to us all, doesn't it? Yes, in every form of exercise. That's great. Thanks, Darren. We've got an interesting question come through from Caroline, who says that her worst side effect is skin problems. She has extremely dry skin with cuts on her feet and fingers, and also suffers with neuropathy. And so we just wondered what you might advise there.
So again, for that, so with the neuropathy, that's probably related if she's had chemotherapy. That can be a consequence of that. There are medications that can help dampen down the nerve responses there, such as pregabalin or gabapentin. And those are medications that your doctor can perhaps start and see how that works. With dry skin, there are a whole load of different creams we can give. So I was just starting off with simple emollients that you can buy over the counter. But then we have other ones that you can see your doctor about to get prescribed as well. And I think the key is, if you have dry skin, to stay on top of moisturizing. So regularly moisturize every couple of hours so that your skin remains soft and supple.
Great, thank you. Good advice. So I have a question from Sue now. So Sue says she suffers terribly with bloating. She actually says, it doesn't seem to matter what I eat, I look like I've swallowed a medicine ball, which I think we can all imagine exactly how that must feel. I feel terrible and I have to lie down. Should I try eating small but often rather than 3 set meals? And is there anything else that you would suggest she tries?
So as I showed in my slideshow, actually bloating is a very common symptom we see in our patients, and there are so many causes of bloating. So it's not just related to diet. It can be related to bile acid malabsorption. It can be related to SIBO or constipation. So I think if it's a really significant problem that you're having and you haven't seen a specialist, that should be the first thing you should do, because you can be investigated for all those things. But then if you're thinking it's maybe related to your diet, as I said earlier, keeping a food diary is really helpful, because you can keep a record of if there are any particular foods that seem to trigger those symptoms. And commonly we find tomatoes, onions, garlic, or green leafy vegetables may start to cause some bloating symptoms.
That's really good advice, the food diary in particular, so you can see which things trigger it. And Darren, we've got a question here from Sally. And she says, thank you, this is really interesting, but Sally suffers from a really distended stomach, post-liver resection, bowel resection, ileostomy, reversal. So she says, I have a very lopsided tummy. How do I reduce this? And she's also got a hernia post-bowel resection. So she's concerned, she doesn't want to do more harm with what she might try. And it's affecting things like sleeping. She says she already walks 3 miles a day and has just started doing yoga again. So what would you recommend here?
I think in more complicated cases like this, especially if you've had hernias related to operations you have, there are things such as abdominal binders that you can wear to help keep the muscles stronger and in place. And occasionally patients find that's helpful. I mean, having hernias, or if you're having a distended abdomen related to the operations that you've had, that can cause other issues. And if you're finding, for example, you're unable to go to the toilet or having vomiting or so on, it's helpful to see a surgeon sometimes, because on some occasions they may be able to intervene and repair any hernias that are there. So again, that's a useful option if more simple measures like binders aren't proving to be effective.
That's great. And where would you get a binder? You know, where would you go for a binder? Is it online? Where would you go?
So again, because they have to be designed as to how well they fit around your body. So I think the best thing usually we find is speaking to a specialist in the hospital. So a lot of the cancer nurse specialists will know about these, especially the stoma nurses. But you can, of course, buy these online, and you can measure yourself to get the right size as well to try them on. So there are options available as to where you get them.
That's great, thank you.
We've had a couple of questions that are on a similar theme, and it's around how long you can take medications to help with some of the side effects for. So somebody asked how long they could take, I think it's Bisokodil for, and then somebody else has just asked, James has just asked, how long can you take antacid tablets for? So different drugs, but what advice do you give?
So Bisokodil is generally given as a laxative to treat constipation. And again, if it's an effective treatment, you could take this in the long term, as long as it's managing your symptoms effectively. Occasionally, as I have shown, we can treat the constipation more naturally by just altering the fiber intake or your diet slightly and ensuring you have more water. So if you don't want to take medications for constipation frequently, then you can always see if adjustments in your diet help. With antacids, we know that they're really effective at controlling the amount of acid that's been produced from your stomach. And again, patients who've had radiotherapy or chemotherapy may have changes that results in them producing more acid from their stomach. And so by giving medications like omeprazole, lansoprazole, they're really effective at dampening down that acid production. So again, in those cases, being on it long term is usually quite effective. And we also always want to balance out the benefits with the risks. Now, usually being on an antacid like omeprazole for long term can affect the quality of your bone health. because it reduces the amount of calcium that you may be absorbing, and may also, in some occasions, be causing loose stool or diarrhea. In that case, with regards to the bone health, we can monitor how strong your bones are by doing specialist scans every few years. But if it's causing symptoms like loose stool or diarrhea, then it probably is a reaction to the antacid, and we could change you to a different type of medication. But overall, I think you can take these long-term fairly safely.
That's great to hear.
It's really interesting, isn't it? Because I think we
yeah.
probably think that you can't do that because of what the box says. Usually.
Yes. Yeah. Got lots of other questions coming in.
We have lots. In particular, we've got one here, which, it's a great question. Andy asks, how much pain is acceptable after treatment? He's had a right hemicolectomy and had chemo, and just kind of wants to know if he should ever be aiming for a point where he's pain-free.
So I think that's a really difficult question, actually. I personally think that any significant pain that patients find isn't acceptable, and there may be other causes for that. So again, we'd investigate for why patients are having pain, and that could be related to the bloating, or that they may be getting, or excessive wind, or due to some of the operation that they've had. But again, if you're having significant pain that's affecting your abilities to sleep or do things, then you should really seek help, because that's not normal and that needs to be looked into further. So really, overall, pain shouldn't be accepted as just a consequence of treatment, and that should be dealt with.
That's, I imagine, really reassuring.
Yes,
for a lot of people.
Absolutely. And on a similar note, actually, we've had a question in here about fatigue. And how common is it, say, even 2 to 3 years after treatment? You know, when should people expect some of these symptoms to kind of fade away? Is fatigue common that far down the line?
Of course, unfortunately, fatigue is common, and it can last for years and years. And that's a consequence of some of the treatments we have. So we have amazing drugs that treat bowel cancer, but some of the side effects of the chemotherapy that we give is that it affects the way your heart functions sometimes, and it also affects the way your lungs work. So unfortunately, those consequences remain there in the long term. And so you may be troubled with tiredness or fatigue going forwards. Also, if you've had a lot of your bowel removed, that affects the way in which you absorb things. And it may also cause loose stool or diarrhea. And again, that can make you feel constantly tired, because it's affecting your sleep and your ability to get good rest. So again, unfortunately, it is something that can go on in the future for some time, but we try to minimize the impact that it has.
That's why things like staying active are so important.
Exactly. And that's why doing the exercises, even no matter how fit you are, is important, because that will still give you benefit.
Darren, do you in Lincoln have access to it? Do you offer patients sort of cancer rehabilitation exercise offered either through Can Rehab or through a specialist practitioner to help with exercise for cancer patients?
So actually, I think at Lincoln, unfortunately, we don't have that referral process where we can refer patients to have exercise rehab like that. And again, that's probably due to a lack of funding. As I said, we were only able to really open up our clinic, specialist clinic, through funding received from the East Midlands Cancer Alliance. But overall, funding in this area is lacking. And when we look at other bowel problems like inflammatory bowel disease, millions of pounds go into these conditions, but actually we're neglected. And that's something we really need to campaign against and get more funding through the NHS for services like this.
Yeah, absolutely. It's so important, isn't it? Darren, you mentioned about red meat consumption and reducing your intake of red meat and how often you eat it. Irene wants to know why is this, and is it still relevant if the tumour's been removed? Irene's finished 9 rounds of chemo and is on oral chemo now.
Yeah, so I think we've all seen in the news that there's a link between red meat, such as beef and lamb, with developing bowel cancer. And so even after you've been treated, there's a risk that you can still redevelop tumours or growths. And by limiting your intake of red meat, we're hopefully reducing this risk of further developing another growth or cancer. So that's why we always recommend patients limit the amount of red meat they're having.
You're not saying no red meat, you're just saying really, really save it for special occasions.
Exactly, yeah.
Darren, one of the questions that surfaces quite a lot through our forums and our sort of peer support groups is people talking about the psychological challenges of regaining bowel control. What advice would you give somebody who's finding the sort of, you know, the psychological element of that really difficult?
So again, a lot of people lose confidence in, you know, doing things because they feel chained to their toilet. They can't go out and so on. And so that affects their ability to function socially. Again, as I've shown, we can treat these issues with bowel control and bowel movements. And just by doing that, we give our patients so much more confidence. So I had, for example, a patient in clinic who was going 8 or 9 times a day to the toilet. And actually, we diagnosed her as having SIBO and gave her a course of antibiotics. And she's completely changed. So she now goes 2 times or 3 times a day. She's able to meet friends. And she's even joined Slimming World because it's given her the confidence to do so much more now. So we can make significant changes and differences to give patients the confidence they need in their bowel control.
That is so important, isn't it? And quite often I think people think they've got to put up with it.
Yes.
And actually, we don't have to put up with, you know, with a lot of these things. There are things that can be done. And Darren, I know there's so many questions here. I'm going to rattle through as many more as we can in the time that we have. But I've got a question here about brain fog from Anne-Marie. And she's finished chemo 8 months ago and is still suffering from brain fog. And wants to know, you know, have you any tips for dealing with that? She's doing crosswords, she's reading, she's doing cross stitch, exercise, but nothing's helping.
Yeah, so I think that's a difficult thing. I haven't really come across too many patients with brain fog. But again, that's related to everything. And when you've been diagnosed with cancer, it's suddenly it's a sudden diagnosis and everything changes in your life. So within the short space of time, within a few weeks, you've been diagnosed and had operations and then started your chemo radiotherapy. And through all those changes, that can affect the way your brain functions. And that could be a consequence of the anxiety that one's going through. So a good way to deal with that is perhaps to seek a referral to a counsellor or a specialist to help with managing or coping with some of these symptoms and to speak about that, because that may also prove to be quite beneficial.
That is really good advice. And again, would you do that through your maybe cancer nurse specialist? Would that be a place to start, or would you go through your GP for that?
So I think if you're still linked to your cancer nurse specialist, then they should be able to get you that referral. But also you can see your GP and they should be able to also refer you to a specialist to deal with that too.
Really good to know, isn't it, that there's all sorts of help out
Absolutely.
there, but you just need to, you need to go and ask for it.
Yeah. That takes us back to what you were saying just now, Darren, about confidence building, having that confidence to say when something's not working and that you want some help with something.
Exactly. Yeah, I think a lot of patients, of course, feel grateful that they've been treated for their cancer and are still alive. But as I said, that's not enough anymore. And we need to ask our surgeons, our nurses, to refer us on to get the help needed, because there are so many things we can do to improve the quality of life of our bowel cancer patients.
What a great place to finish, Darren. I'm so sorry we have run out of time. We did have so many more questions that we will do our best to answer offline. But
yeah, so if we didn't get to your question, so sorry, but we will try and get back to you. And thank you so much, Darren. That was
You're welcome.
Absolutely.
Thank you for having me.
And thank you for giving up some of your Saturday.
That's okay. It's always a pleasure.
Brilliant. Everyone, I'm sure you'll all join me in a virtual round of applause for Darren. I can hear clapping the other side of the door here. Darren, thank you so much.
It was brilliant. Wonderful. So what's next, Catherine?
Next, well, continuing the theme of red meat, actually, up next, because we have Joanna Injore joining us next. Joanna is a speciality oncology dietitian, and she's worked across the NHS. and for Macmillan, as well as being director of her own business, JI Nutrition. That right? It's JI Nutrition, isn't it? Brilliant. So Joanna's going to be guiding us through the challenges of eating well with bowel cancer, managing changes to your diet, and how diet can help you manage side effects. So don't forget to put your questions for Joanna in the box, and also keep the chat coming, because we're seeing some great conversations happening there. So Joanna, over to you. Welcome.
Hi Joanna, great you could join us this morning. I can't wait all about this. So let's crack on.
Yeah.
Great, thank you very much. And I hope everyone's finding the day interesting so far. I know there's been lots of interesting topics. So just a little bit quickly, let me just make sure that I can, there we go, a little bit about me. So as Caroline's mentioned, I'm Joanna Injore. I'm a registered dietitian. I've been practicing since 2004, and I have worked both on NHS and privately, and I run my practice JI Nutrition. And below I've just put my social media links, just in case you're active on social media, because I post a lot of nutrition and cancer diet tips and information, and have a blog on my website that's got lots of information too. So if you're on social media, do give me a follow. Okay, so today I'm going to sort of give an overview of the foods to include during your treatment, and also talk about common nutritional issues that you may arise during treatment, and how to kind of manage your diet with that, and have a bit of a special focus on bowel changes and how diet can manage those symptoms, and also take a look at diet post-surgery, because that's get quite a lot of common questions around that area. And then finally ending on diet recommendations for cancer prevention, and of course having some time for questions at the end. Okay, so during treatment, we need to ensure that we're eating as well as we can, so that your body's got really enough nutrition to keep your weight nice and stable, and to enable healing. That's really important. So here are the general main food groups that we all need to include in our diet, and particularly during cancer treatment. So first of all, looking at your protein foods, these are your meat, your chicken, your fish, your eggs, and your plant-based sources like your soya, beans and tofu, etc. And we need these foods to help our cells to be healthy and to give vitamins and a source of energy as well. Moving on to your fruits and vegetables, we need to make sure that you're having some fruits and vegetables in your diet, even if you've been asked to follow a low fiber diet, because they provide your vitamins and minerals, and also have a good function of providing fiber in your diet, as well as feeding that healthy sort of gut bacteria that's important for your immune function. Next, we have our carbohydrate foods. So those are your bread, your pasta, plantain, cassava, couscous, rice, potatoes. And these are really important to have some carbohydrate foods at each meal, so at breakfast, lunch and dinner, because that provides you your energy and your B vitamins. It's really important to include some of those foods. Next, we have your dairy foods, so your milk, your yogurt, your cheese, and your plant-based sources. So if you're following a plant-based diet, try and choose the versions that are not organic, because those versions are not fortified with minerals. So make sure for your plant-based sources, you're choosing just the standard and not organic versions. And then lastly, we have our fats and oils group. And also our healthy fats are included in there, like from nuts and oily fish. And it's really important to include some of these foods into our diet, because we need them for the energy that they provide. And also during treatment, your energy and your protein needs are much higher than maybe say when you're normally, because your body's working that much harder. So you might need to include a little bit more foods from your sort of fats and oils group, and maybe the proteins and carbohydrates, just to make sure your body's getting enough nutrition. And it is okay to have a few sweets and cakes as well. That's fine too. Don't be scared to do that. Okay, so moving on to common nutritional issues. So bowel cancer treatment, as some of you may know, can involve surgery, chemotherapy or radiotherapy, or a combination of these. And each of these treatments will have side effects that could affect your bowels and your eating. So these are the common things that you could experience, which I'm going to talk about each of those individually. So having a reduced appetite or weight loss is quite common during cancer treatment, and these are my top tips. First thing is aim for sort of small meals and snacks, and more regularly, because that's much easier for the body to manage when you're really feeling like not eating. Make each mouthful count. So that sometimes can mean adding some extra calories, maybe adding a little bit more butter or adding a little bit of cheese to your food if you're losing weight, just to make each mouthful count, but not increasing the quantity of food you're eating. And that goes with just going for foods you enjoy. So making sure that you're going for things that you like to eat and you're enjoying. And don't be afraid to have those nourishing snacks or desserts, you know, those high calorie foods, because you do need them at that time. And if you're really struggling with your weight or with your appetite, then do ask for help and support, doctors in your team who might refer you to a dietitian for extra support. Taste changes. This is also very common in treatment. It's because the cells in your tongue grow very, very fast. So when you're having cancer treatment, that is affected by the treatment quite quickly. So one of my top tips is making sure you have really good oral hygiene. So making sure you're caring for your mouth and brushing your teeth properly, and maintain that good oral hygiene so that it minimises any chance of infections. Keeping hydrated, so making sure you're aiming for your 2 litres of fluid a day. You might find if you've got a loss of taste, maybe enhancing the flavour of your food is helpful. So maybe adding things like some lemon or garlic or some spices just to kind of enhance the flavour so you can taste it a little bit more. Quite a common side effect is experiencing sort of a metallic taste in the mouth. And some things that can help is like maybe switching to plastic cutlery. Sometimes that's quite helpful because you haven't got that metallic taste. And also some people found that adding cinnamon can help neutralise that taste a little bit. And you could add cinnamon to sort of cereals or desserts and things like that. And also finally, just having some mince or something like squash to kind of just before eating to neutralise the taste in your mouth is quite helpful. Sticking with sort of mouth issues, another thing that can happen is having a sore mouth or getting some sort of sores or sore patches in the mouth. And also another key tip is having really good oral hygiene again. So, you know, making sure that you're keeping your mouth nice and clean and using a sort of soft toothbrush to clean your mouth, and sipping lots of sips of water just to keep everything nice and moist. And that's to just minimise any risk of infections. You might find some foods are particularly problematic when you've got a sore mouth. So avoiding things that are hard or dry that are going to kind of get stuck in those little sore patches. So things like crackers or bread, dry breads or nuts and things like that can kind of be a bit sore. And also anything astringent, anything that's going to be spicy or citrus can sometimes be a bit sore. So during this time, just maybe think about cutting back on those things if it's a problem for you. And then how to kind of improve your eating is just adding some extra sauces or moisture to your food, making things really soft as possible, like cooking your meat really soft and long and slow, just so it's nice and soft and easy to eat. And really take your time with eating. Take your time, take it slow, you know, to have smaller amounts but more often again, just so that it's easier to manage. And overall, just kind of keep it quite relaxed as well. A relaxed environment with eating to reduce sort of the pressure and everything else. So just take your time when your mouth is sore. Nausea and vomiting are also another common side effect. And you might find during this time having some savoury, plainer type foods are really helpful. So things that are dry or plain might be just a bit easier, like crackers and cold foods as well, because they tend to smell less. And also with cooking, smells in the kitchen, like just maybe think about opening the window when you're cooking, or sitting with the window a little bit open during eating, just to kind of reduce those cooking smells that sometimes can make you feel a bit nauseous. And if you're on any medication for managing your nausea, do speak to your team about that. Just make sure they're optimizing that as much as possible. And remember to take your anti-sickness tablets at least half an hour before meals, just so they've got a chance to work. And some people find things like peppermint teas are quite useful at keeping like that sticky kind of feeling at bay too. Okay, so moving on to managing bowel changes. So these are the 3 sort of common bowel changes: wind and bloating, diarrhea, and constipation. So wind and bloating. Wind and bloating is one of those common side effects that you can experience. And one of the most top tip that I have is making sure that you're eating slowly and chewing your food really well. And it sounds really simple, but actually a lot of us don't realize how fast we eat. But when you eat too fast, it can lead to you swallowing a lot of excess air, and that can make you feel really uncomfortable and bloated. So that's the #1 top tip, to make sure you're not eating too fast. Peppermint tea again can kind of be helpful with reducing those bloating feelings, as well as including some oat-based foods into your diet, so like oat cereals or biscuits. Oats have been found to have a little bit of a improving effect on those symptoms. Sugar-free products like sugar-free gums or fizzy drinks or foods sometimes can contain a sweetener that has that can affect your bowels and cause wind and bloating. So just avoid those if they are a problem for you. And below, I've just put some foods there that are commonly associated with wind and bloating, such as cabbage, cauliflower, onions, garlic, sweet corn, broccoli, sprouts, beans and pulses. But remember, everyone is different, and don't restrict these foods unless they're a problem for you. So you might find that if you try them, they're okay, then continue eating them. But for you, if they cause a problem, maybe think about cutting back on those things, but don't restrict them all as a rule. Sorry, moving on to diarrhea. So diarrhea, one thing we want to make sure of you're experiencing loose stools is to keep hydrated. We really want to prevent dehydration. So keeping your fluid intake up, and remember your fluids include sort of your teas and coffees, and some fruit juice as well. But just be careful with these things, because caffeine can stimulate the gut a bit and increase those diarrhea symptoms. So just stick to no more than 2 cups a day. And alcohol as well can stimulate the bowel, and also fruit juice. So just kind of try and keep those to a minimum if you can. And also sweeteners, again, they can also stimulate the gut too. And always just, refer back to your medical team if you're really struggling with that. It's also worth remembering too that the gut is also affected quite a lot by emotions and stress. So obviously it can be a very stressful time. So having good relaxation and stress relief and building that into your day if possible can have a helpful effect on your gut as well. Constipation. Again, fluid is really key with you having constipation, because we need your fluid to keep your stools nice and moist and easy to pass. So keeping up your 2 litres a day fluid. Aiming to keep your meals regular, but that has a real effect on the bowels. Just having that regular intake of food just helps to keep the bowels regular too. You might find that you need to add a little bit more fibre into your diet. So if you can, add in a little bit of fibre to your tolerance level if possible. That's a good idea. And also including some oat-based foods like cereals, again, is helpful. And also thinking about activity. So activity and keeping mobile as much as you can does help with constipation. All of that movement is really helpful with managing your bowels. And I've also just put about flaxseed. So ground flax seeds are found to be quite useful in constipation. So you can buy sort of ground flax seeds, or linseeds are also the other name for them. And they could be added to cereals in the morning or yogurt. And we don't want to have more than 1 tablespoon a day, and you'd want to sort of slowly build them up. And that's also another thing to remember. If you're adding extra fibre and things to your diet because of constipation, to do it gradually, do it slowly so your gut can kind of get used to it, and make sure you're having enough fluid to manage that too. Okay. I'm just going to touch a little bit on diet post-surgery. And whilst not everyone with bowel cancer will need this type of surgery, I just wanted to include just some basic information on this. So you will see we've got 2 types of colostomy, 2 types of stoma bags. First one being a colostomy, where part of the colon is brought out to the stomach, and it collects, as you'll see, there's a little bag there, it collects waste in the stoma bag. And when you've had this type of colostomy bag fitted, you might be asked to follow a slightly lower fibre diet, just while your gut is kind of getting used to that. So you might need to cook your vegetables and fruit a little bit longer, make them a bit softer, maybe peel the fruit and peel the vegetables, make sure they're well cooked, just to help your stomach get used to it. Aim for regular meals again. That's really important to kind of keep everything regular, keep the stoma working regularly, and keep up with your fluid intake. And the aim is really to kind of try to get you back to a normal diet as possible. So keep trying and introducing new foods slowly into the diet. Next, we have the ileostomy. So this is where the small bowel this time is brought out to the stomach to collect waste materials. You'll find that if you have an ileostomy bag and a stoma bag, the output will be a little bit more watery than say maybe a colostomy bag. And again, the first thing to do is make sure you're following that lower fiber diet to start with, just so that your gut is kind of getting used to having food back in. And the aim again is to start introducing some higher fiber foods back slowly. So that's really to tolerance. It's taking on your individual level of what you feel you can manage and doing it very, very slowly. And again, regular meals is really important here because you want to avoid long gaps between eating, because that can lead to a build-up of gas in the bag as well. So that goes with eating slowly, making sure that you're eating slowly and chewing well, so you're not got that build-up of gas. And that's the reason why I put avoid drinking with meals, just because when you're drinking with meals, sometimes you can swallow lots of excess air. And there are some foods that maybe you might need to continue to avoid, such as skins or celery or sweet corn or nuts, things that are a bit more harder to digest. And sometimes you might find that keeping sort of a food diary to just see how you're coping with introducing a new food back into your diet, to see how you manage that and see what the symptoms or the effect of the stoma bag is. But ideally, our aim is to kind of try and get you back to a normal balanced diet. And you might find that you need some extra support with managing if you've had a colostomy or ileostomy bag fitted. You might need to have that extra support. So do speak to your stoma nurses and dietitian as well if you're struggling with eating. So finally, sort of moving on to cancer prevention and reoccurrence. So the advice here has been based on the World Cancer Research Fund, which conducts sort of a systematic review of all the evidence related to diet and cancer recommendations. So the things that are recommended are, aiming for some whole grain foods if possible. And this is just higher fiber. So fiber is really key, trying to keep the gut healthy. And everyone should be aiming for 30 grams of fiber per day. But obviously, if you've been asked to have a lower fiber diet, that would need to be sort of manipulated a little bit in the lower fiber choices. But our aim is to still try and have some fiber and some fruit and vegetables into your diet. Next, we have about red meat. I think that was a question that I heard of just being mentioned from the previous talk. So the advice for red and processed meat is avoid processed meat if possible, and your processed meat will include your ham, pepperoni, hot dog, chorizo, corned beef. Avoid those as much as possible. And for red meat is to have no more than 3 portions of red meat per week. And that's sort of the guidelines for bowel cancer prevention and reoccurrence. Keeping active again is really key. So trying to, if you can, keep active. As I say, it's just good to try and minimise the time sitting at home if possible, doing gentle activity. The recommendations are aiming for 30 minutes of activity 5 times a week, but start slow if you need to exercise, and start just to break it down into chunks. So you're trying to just get up and move a bit more. And that helps by just keeping your weight nice and stable and helps the food to kind of pass. Being active helps food to pass through the digestive system a bit quicker. Reducing your alcohol. So for cancer prevention, it is advised to avoid alcohol, but if you do drink, try to have some alcohol-free days where you're not having any alcohol at all, and definitely don't exceed your 14 units a week. And then finally, keeping to a healthy weight. So that can reduce your risk of a number of cancers and other diseases, and trying to, as I say, eat sort of a balanced diet as possible. Being active will hopefully help to keep your weight nice and steady and in a healthy rate. Okay, and I'll move back that way. And just to summarise, as I said, important to speak to your healthcare professional if you're experiencing bowel symptoms or problems with eating. That's really important. Really important to keep enjoying your food, because the food is not just about nourishment, it's all about enjoyment and that social experience. So please keep trying to bring back to that normal eating and eating as well as you can and enjoying your food. And as I said, if you are experiencing any problems, do seek some support from a dietitian as well.
Brilliant. Thank you, Joanna. Thank you so much.
Fascinating.
Fascinating, yes.
Really
we've got enough questions to keep us going in the next 10 minutes.
I had no idea about plastic cutlery.
No,
That is
or cinnamon.
Cinnamon, such good tips.
But we will ask questions that have appeared in our question box.
Yeah,
so
great.
It's okay with you. I'm going to kick off with one from Caroline, who says, I'm putting on weight and I'm hungry all the time. I eat as healthily as much as possible.
Mm-hmm.
What's your advice?
So we have to, and the thing is with hunger is also to have a look at whether it is hunger or whether it's something else as well, because sometimes we eat for other reasons. So maybe thinking about what's going on at the moment, what kind of foods are you reaching for when you're feeling hungry, and then maybe looking at activity level as well, like if you can slightly do a little bit more activity too. But yeah, I'd say when you're feeling hungry all the time as well, just thinking whether it is actually hunger or whether it is, something else, whether it's just boredom or comfort as well, that sometimes can mean while we reach for certain foods.
Sometimes when I feel hungry, I'm actually thirsty. Do you find that? Yeah. So there's another question here from Sandra, who's got an ileostomy, and she had conflicting advice about fruit and veg to avoid. So she like oranges and tomatoes, and she's finding it hard to eat healthily. So should you be avoiding the citrus fruits, the tomatoes, or are they okay?
For tomatoes, usually things like passata, like the sieved kind of no skin tomatoes are usually okay. It's the skin that's probably a problem, and if they're cooked, it's usually okay. Citrus fruits, it depends, to be honest. It depends on you as an individual whether that kind of affects your output, your stoma output. For some people it might not at all, but for some it does. It's a bit of, unfortunately, a bit of trial and error, trying it and seeing how it affects you. And if it doesn't affect you, then to cut it back.
That's good advice. So just be mindful of what you're eating and see how it's affecting you.
Exactly, yeah.
Right, so we've had lots of questions about specific foods. So should we do a little quick fire? We'll give you food, you give us yes or no as to whether or not it's beneficial or perhaps to avoid.
Yeah.
First up, chocolate.
Chocolate. Chocolate is fine as part of a healthy diet. It's something that we enjoy. No problems avoiding chocolate. Don't need to avoid it.
Closely followed by an equally, I think, popular one, coffee. So lots of people, they've heard to avoid coffee.
Yeah, so the caffeine in coffee, it does stimulate the gut. So I would say that stick to no more than sort of 3 cups of tea or coffee a day, because that can have an effect on the gut.
Okay, great. Interesting question. Is pork red meat?
Yes, it's classed as red meat. It is.
That counts as red meat. And what would you say is a portion in grams?
Portion, so I would say it would be like a small steak would be the size of your hand, the palm of your hand, the portion. Yeah, that's a portion of meat. So that's a good guide.
That's a good way of looking
at
it, isn't it?
Helpful. We've all got, well, most of us have that on hand. Oh, that was dreadful, wasn't it?
It was really dreadful. Yes, moving on. What's your opinion of kefir? We hear a lot about kefir for good gut health, don't we?
Yeah, so the evidence is still a bit limited about kefir. I mean, there are evidence of like probiotic use, and that depends on certain strains. But kefir in itself is a bit limited in terms of the nutritional benefit. And also, if you're having treatment, you might be advised not to have to be avoiding things like probiotics and anything with live bacteria. So just to bear that in mind.
So that would be a question really for your team if you're going through treatment.
Yeah,
definitely.
Yeah.
And a couple of people have asked, are frozen and tinned fruits and vegetables as beneficial as fresh?
Yes, definitely. They all count as your fruit and vegetables, and sometimes those are much easier and quicker to prepare. So if that means that you're going to eat more, then definitely go for those options. But nutritionally, no, there's no difference. It's just as good.
I had no idea about that. That is really good to know. And we've had another question in here about switching to a vegan diet.
Okay.
Thoughts on that?
So a lot more people are becoming a bit more aware of following plant-based diets. So vegan diet can be just as healthy as a meat eating diet, but I would say there's no definite need to switch completely to a vegan diet for health reasons. You can still have a good diet and maybe cut back a bit on the red meat and have more plant-based sources on those days. But if you're completely vegan, you just need to be making sure that you're careful to get enough protein from the good protein sources like the beans and pulses. And if you're having any dairy products like plant-based, they have to be fortified with calcium. So what I mentioned at the beginning was your organic versions of those plant-based foods are not going to be fortified. So don't have the organic. If you're vegan, go for the non-organic versions. And also things like plant-based meats, you need to shake them because the calcium and the minerals drop to the bottom. So every time you pour it out, to shake the bottle.
Oh, top tip.
That is really good. We've had quite a few questions in about vitamins and supplements and things like that. And people wondering whether, if you don't feel you're getting, because of maybe you're uncomfortable on certain foods, should people be supplementing with vitamins?
So if you're restricting quite a lot of fruit and vegetables, it might be a useful idea to have a look at that. But you might find that it'd be good to speak to your team about that, because if there's things that you're worried about, they can always do blood tests to check your levels, and that's the best way to find out whether you're deficient in anything, by checking your blood levels. And if you are to have a vitamin and mineral supplement, you would just need to go for a basic supplement, just a general one that has nothing high, nothing in excess of the recommended daily allowances. You want it all to be within the allowances. We don't want to have excess of vitamins and minerals, because that can be dangerous as well, especially in cancer treatment.
Right.
That's definitely one to watch then, isn't it?
It is.
So always get advice really from your team or dietitian about that. Yeah.
Right. So we've got a question here from someone who's got cancer present in their liver and lung nodule. And they say that they get stomach ache when they're having a break from their treatment. And they've been told by their nutritionist to cut out bread to try and solve that problem. They're really missing it. They're missing, having meals where bread would be part of it. So they're wondering what the best thing is to try and replace bread with.
And then oatcakes and crackers. Yeah.
I think I'd need to look a bit more about why they've been asked to cut out bread, because that's not something that I've heard of, to be honest. I mean, you should be able to manage to have.
I think they've been told
bread.
It's difficult to digest.
Yeah. I would say, there are alternatives in terms of you could have cereal products instead, if that's easier. But really kind of thinking about, we don't want to restrict things unless we have to, really. That's the key. Just trying to manage your diet with, having that balance of diet is really important. So if you're not having bread, then you need to think of cereals as another option, or things like rice or pasta, but or couscous type foods as well. But I would look at maybe why you've been asked to restrict bread as well in a bit more detail.
Maybe query that. It's difficult.
Yeah.
Nothing comes close to toast, does it?
No. We were having that discussion. So
yes.
Toast.
So what about sugar? Is there any evidence that sugar can cause bloating and pain, or is it just generally a bad idea? And particularly for a post-surgery bowel, that's a question from Andy.
So there's a lot of information and myths about sugar and cancer, and there is no evidence about sugar feeding cancer, etc. There's no evidence there. In terms of sugar and sort of bowel health, I would say that the sweetener versions, the sweetness can affect the gut. So anything made with sorbitol is often one that's in lots of chewing gum and diet products, and that can have a stimulant effect on the gut and cause sort of looser stool. So those are things to maybe avoid. But sugar in itself, is found in lots of different things, in natural foods as well, and it's quite hard to eliminate them altogether. And actually, if you're struggling with your weight and a poor appetite, you might find having foods with a little bit more, like the desserts and things like that, nourishing desserts, things like rice pudding or custard and cakes, they're actually quite a useful source of calories during that time. So you wouldn't want to cut back on those things, really.
Oh, we heard it here first. Don't cut back on cake.
Yeah, well, I noticed the mint cake right early on in your presentation, Joanna. Lots of other questions, supplements like turmeric and green tea, and people, really wanting to know about things like that, not necessarily vitamins.
Yeah, there is a lot. I think diet and cancer is one of those things where there's so much out there on the internet and things to look for, and there's lots of misinformation, unfortunately. There really isn't much evidence for turmeric and such, and also need to think about with turmeric is actually a particular ingredient in the turmeric that gives it its color, but actually that mineral is really small percent in say like a spoon of turmeric. You'd need to have like, I think a 10 grams or something of turmeric to have any effect, which is impossible to kind of eat. And supplements have not been shown to have any benefit really, and they can be quite harmful. So I would say the evidence is really not there for things like green tea and turmeric, and always to query those sorts of things that are presented in the press as being like a wonder cure, because usually they haven't got the evidence behind it.
That's really helpful. We haven't got time for any more questions, have we? I'm so sorry about that. There are some more. As ever, we will try and get back to the people whose questions we haven't been able to answer in that session, and we'll get back to you directly. And actually, there's one question about menopause, which I think perhaps could come to a discussion with Dr. Philippa Kaye later this afternoon, because I know that she's written about menopause as well as bowel cancer. Yeah. So thank you so much, Joanna.
Yes, thank you. It's sort of got the tummy rumbling a bit there with all those pictures. But it's great that you were on just before the break. Fabulous. So again,
thank you
everyone to join me in a virtual round of applause.
Thank you very much. Thank you very much for inviting me. And I do have like lots of different blogs on nutrition topics, like popular ones on my website. So you can have a look at those as well. There's a bit more detail about sugar and cancer, because I know that's a common one too. So
we'll signpost everyone to those. Thank you.
Thanks.
Enjoy the rest of your weekend.
Thanks, Joanna.
Bye, everyone.
Take care.
Bye-bye.
So I was wrist slapped after the first speaker because I forgot to mention some publications that we do that can help. So I'm determined not to forget now. So we do have a publication titled Eating Well, which is available to download on the Bowel Cancer UK website. So if you've still got questions following Joanna's talk, then that would be the booklet for you. And then going back to Darren, we have a couple of publications that might be really helpful for people to have a look at. One is titled Regaining Bowel Control, and the other is Living Well with Bowel Cancer. So do have a look at our website, have a look at those publications, and if you've got any questions, hopefully the answers are in there. So it's now time for a break.
Pop the kettle on.
Pop the kettle on. Don't hold back on the cake, I say. And Joanna says.
She did say we could have a slice of cake.
She did say we could have cake. You might also want to get your chair ready for chair yoga. So our last session of the day is a chair yoga session. So you just need a sturdy chair, a kitchen chair, a dining room chair, and just make sure it's not on a slippery surface. Have that ready. Caroline's off the cake. That's great. And yes, just do tell us what you've enjoyed so far. And you're not going to miss anything. We're going to put the slideshow back up over, and the music, I think the music's coming back over the break. So you're not missing anything if you step away. What we do ask though is please don't leave the webinar, because if you do, it can be quite tricky sometimes for us to then get you back in. So leave it running, put it on mute if you don't want to hear the music, and then just go and get a cup of tea, bit of cake, fresh air, stretch your legs.
And we'll see you at 12:15.
And we'll see you at 12:15. Bye. Hello, I'm so sorry, Jen. I turned the camera on and you were mid-crunch. I'm sorry.
Yeah, nice cake though.
Welcome back, everyone. I hope that you all had an opportunity to stretch your legs, get some fresh air, have a cup of tea, get your chair ready. One question that I'm fascinated by thinking about what the answer could be is how many of you are sat around a computer or a phone or a tablet, but you've got somebody with you? Is there somebody else watching? Because we only can see how many people have logged into the webinar. What we don't have a sense of is whether or not there are 3 of you watching. So in the chat, if you've got people with you, can you just tell us about that? Tell us who's with you, tell us how many, just so we can get a bit of a sense of how many people there are out there.
That would be lovely. That would be absolutely lovely. And in the meantime as well, I just want to highlight something in the chat, which is that talking about cake, in August, it's our Brew Together event, which is basically a lovely excuse to gather together with your family, in person or virtually, depending on, you know, whether you can get together or not, with family and friends. Have a nice cuppa and a slice of cake, and all of it raises money for Bowel Cancer UK. So isn't that great?
This is work, right?
Yeah.
Wow, I'm up for that.
Absolutely, absolutely. So if that sounds appealing to you, we would be hugely grateful. But have a look at our website, you'll get all the details there.
Brilliant, thank you. Yeah, what a job we've got, hey?
Yeah, I know.
Okay, so we've got lots of me and my wife, daughter, dad and 2 daughters. Oh, Carol and the long-suffering husband, Ken. Her words, not mine. I wouldn't dream. But hi, Ken. So that's fabulous. We've got just me with my daughter. Brilliant. It's great, isn't it? It's brilliant to think of everybody around the UK.
It is. It's really, really lovely. And I just think this morning it was fascinating hearing from our brilliant panelists. What have we got coming up?
Well, up next, we have Robin Muir talking to us about the sort of psychological impact of a cancer diagnosis. Then we have Philippa Kaye, Dr. Philippa Kaye, joining us to talk to us about her experience with a bowel cancer diagnosis, and then finishing up with chair yoga with Denyse Ritz. So yeah, plenty more to come.
There's loads on. I can't wait, actually. I'm so looking forward to this afternoon. We've got some really interesting topics. So first up is Robin.
Is Robin, yes. So Robin is a clinical psychologist and he's head of the Maggie Centre in Manchester, where he supports people with cancer and their friends and family. His focus for our session now is going to be the emotional impact of living with and beyond bowel cancer. So I'm delighted to say a huge hello, good afternoon, Robin, to you.
Hello.
You're probably a little bit confused about all the cake talk if you weren't with us for Joanna's talk, but she did say it was okay to eat cake. So we
always fantastic.
Absolutely.
Good to know.
Good to have you with us, Robin. Thank you so much.
No problem. Thank you. So afternoon, everyone. Just before I get started in the presentation, I just want to apologize if there is any noise in the background with these sorts of virtual events and working from home. Obviously, you can hear other things which are going on in the house. My wife and I have 2 little children in the house, and our 2.5-year-old is not playing ball today. He's had a very exciting morning. So I think she is, my wonderful wife is going to be trying to put him down for a nap at the moment. So there's a chance that you might hear a little bit of him resisting that. So please don't be put off it. Hopefully it won't distract me too much. Worst comes to the worst, he might run into the room and you all might meet him a little bit. But hopefully that won't happen and we can stay focused on bowel cancer and psychological impact of it. So yeah, my name is Robin Muir. I am the centre head of Maggie's Manchester, based at the Christie Hospital, and I'm also a clinical psychologist by background. I've worked in physical health really from even before I started training as a clinical psychologist. So I used to work in chronic pain, angina management, and also a bit of neuropsychology as well. I got into cancer work when I qualified as a psychologist in 2014, worked in NHS at Royal Bolton Hospital, just north of Manchester, and then moved to Maggie's about 5 years ago, where I have been sort of leading the programme there. And also, I think my job at Maggie is, the way that I see it, is it's helping people to adjust and adapt to the situation that they find themselves in, which I'll kind of talk about today as being a core part of one of the challenges that face people who are affected by a cancer diagnosis, both those with a diagnosis themselves, but also their loved ones as well. So hopefully this will work for me to move on. It doesn't seem to be, so if we could move to the next slide. Now on my screen I have, that's a bit better. There we are. Lovely, thank you. Let's see if I've got control. I'm not sure. Well, the slide that I can see in front of me is the right one for us to start on. So hopefully you can all see 3 circles with arrows coming out of them. This is a kind of loose structure which I use to help people.
Robin, we can, sorry, but
good.
we can see how to care for our psychological well-being.
Fantastic. Lovely, thank you. So yeah, this is a basic model which I use to help all of us to just think about how we care for our psychological well-being. It's not particular actually to people who are affected by cancer. We could explore it, use it for any of us, particularly at times where there's something happening in our lives which is going to have a significant impact on us emotionally. So I think that process starts by acknowledging that emotional upset, psychological distress, whatever we want to call it, whatever the language is that you feel comfortable with around psychological well-being, acknowledging that that's going to happen, that it is happening. Once we've done that, moving on to exploring and understanding what is actually happening, what are the different emotions that we feel, maybe why are they arising, those sorts of things. And then lastly, thinking about how we manage those emotions and the impact that it's having on our lives. Often, I think very understandably, people want to get to that third step about managing. They often want coping strategies straight away. And I can completely understand that when your life has been turned upside down, as it is with a cancer diagnosis. But it can often be really helpful actually to do those first steps of acknowledging, exploring and understanding before we think about putting coping strategies in place, because it just means the coping strategies that you'll use better, you'll choose the right ones for you in that situation. So I'll move on to the next slide. There we go. So acknowledging our psychological well-being. So I think as a psychologist who works within cancer services, what's really, really important is actually just to acknowledge and normalize how normal it is, how typical it is for somebody to experience psychological distress around a cancer diagnosis, around cancer treatment, and sort of everything that comes from that. I often think about that experience as being a little bit like throwing, a rock into a lake or a pool of water, and you'll see really significant ripples coming away from that. Often what happens when these big life events happen to us is that we have emotions which are about an adjustment or an adaptation process as we kind of take stock of something very significant that will have an impact on our lives and the lives of the people that we love. But those emotions are generally, they're uncomfortable. Often we are used to having what we might see as positive or helpful emotions when we experience good things in our lives. But unfortunately, when the bad stuff does happen to us, as we know it will do, the emotions that come from that can be uncomfortable. That's not to say that those emotions are not helpful to us, though. And I think those difficult emotions, so we might think of anxiety, we might think of sadness, can sometimes actually be helpful to us. And in a similar way, they are like physical pain can be, in that we don't like physical pain. It's not something that any of us tend to enjoy having, but having physical pain can actually be helpful to make us aware that there is something wrong, perhaps within our body, that perhaps we need to adapt how we're doing something, and that helps us to look after ourselves. So in that way, these difficult emotions can actually be helpful to us if we pay attention to them, listen to them, and then think about how we can cope with them and manage them. What people often find is that if they get caught into a struggle with these emotions, so they see having the emotions as a bad thing, they may try to fight them or stop them. And sometimes what that can actually do is it can actually intensify our distress. So we might start to feel guilty or embarrassed for how we feel about a cancer diagnosis, cancer treatment, and the impact that those things have. So there we are. So just to kind of give us a bit of context as well. So I suppose one of the ideas I'm giving you is that unfortunately with a cancer diagnosis will come psychological upset and distress. I think that seems like a fairly reasonable thing to argue. I think most people will find some level of distress, emotional upset when they're diagnosed, when they're facing the difficulties of treatment, and even once treatment's perhaps finished and they're perhaps being seen in follow-up clinics and they're dealing with aspects around recovery, that psychological difficulties can arise then. But thinking about how common is common, so we think as psychologists that the research that we've done shows us that the prevalence of significant psychological distress is somewhere between 25 and 50% of people who have a diagnosis. So that breaks down into, the research shows us that 25% of people who have a curative diagnosis and are having curative treatment, 25% of those people would benefit from formal psychological support. So that might be from somebody like myself, or it might be somebody who is a CBT therapist, a counsellor, or sort of any of the other types of psychological practitioners that you might see. Somebody whose sole focus is to help you with your psychological well-being. That number then increases up to 50% for people who have a non-curative diagnosis. And that probably just reflects the psychological complexities around being given such a diagnosis, ongoing forms of treatment, the uncertainty that lies around that diagnosis and treatments. So we'd estimate 25 to 50% of people with those different diagnoses would benefit from formal psychological support. But sort of leading with that idea that actually probably most people who receive a diagnosis are going to see some level of emotional upset and distress, I think it's important for us to acknowledge that everybody needs to consider their emotional well-being when they're affected by cancer. I mean, I would argue that for everyone at every point of their life should be thinking about their emotional well-being. Just as we've been taught probably over the last sort of 10 to 20 years, we really need to look after our physical health. We need to be proactive about it. I think we need to start thinking in similar ways about our emotional well-being. We have a tendency to take it for granted. We take our emotional health for granted when it's well. Unfortunately, then crises will often hit within our lives and we're perhaps not prepared for that. We haven't perhaps put things in place. We're not sure about how we can manage our emotional well-being. So I would argue that it's important that we do this as proactively as we can. So, I mean, ideally for me, we would be doing more psychological well-being for people, children in schools and even with adults, and we'd all be sort of seeing societal change around sort of looking after our psychological well-being. But for people who are diagnosed with cancer, I would argue that starting point of a diagnosis and all the way through treatment and into recovery in the years beyond, you can be thinking about your psychological well-being when there isn't a crisis, before crises may hit. So things are just going to be good for you in terms of sustaining your well-being. I'll come back to some of those ideas later about things that you might be able to do to put that into action there. So some reflections that I would offer you about my work. So I've worked with people who are affected by cancer now for just over 7 years. And I have to say, one of the things that I was most surprised by very early on and continues into the work that I do now at Maggie's is the guilt and embarrassment that people feel often around their emotions. I don't think a day goes by where I sit down with somebody, perhaps it's the first time that I've met with them, and they will talk about feeling guilty or embarrassed about the emotions that they're experiencing due to cancer. So that might be that they've been given a diagnosis and they're feeling really worried. They're feeling worried about their ability to tolerate treatment. They're worried about the impact it's going to have on their roles, perhaps as a mum, as a dad, on their working life. Very reasonable concerns. But they then feel embarrassed by that. They'll often talk about feeling that they're not doing well enough, that other people are coping much better than them. And sometimes we may see a reflection of some narratives that exist within our society around cancer, such as the need to be positive or battle cancer. Unfortunately, those feelings of guilt or embarrassment or feeling that we're not doing well enough tend to increase our suffering because we then are blaming ourselves, essentially. What that can then drive is often people wear masks with one another. So I think we see that often between loved ones. So in couples, where the person with the diagnosis will often wear a mask and maybe not acknowledge with their loved one how they feel, the fears that they have, but also their loved one will also do the same. They will also wear a mask about the stress that they may be feeling, the anxieties and worries that they have as well. And actually, it tends to then cut us off from each other. And what that can do is it leaves people feeling quite isolated within their experience. And I think that's a very common occurrence that we hear for people with a cancer diagnosis, despite the fact that all of the loved ones and friends and family that they have around them that are often given expressions of maybe wanting to help, that they still feel isolated, maybe because they're not able to be open and honest about how they do feel. So I think the antidote to that is compassion. It's about us being kinder to ourselves, allowing ourselves to struggle with things which are very difficult experiences within our lives, acknowledging that the emotions that you feel out of a cancer diagnosis and treatment are very normal, they're very reasonable things to have. I think personally they are a reflection of everything that is normal about people. But that a cancer diagnosis and cancer treatment is the abnormal part, that it's generally something which, whilst it affects a lot of people, people are generally healthy for most of their lives until a cancer diagnosis. And so that's where the abnormality lies, that we go from often being quite healthy to being told that we're very unwell. And it's very normal then to have a very strong emotional response to that. And so I think these emotions and thoughts are just a reflection of people's humanity. I don't think there's anything that needs fixing about these people that might be struggling, but actually they need support in thinking about how they manage those challenges as they're moving forwards. Compassion in its most simple form, it's a very complex thing, but to break it down into something that might be quite simple for us is being aware and open to our own suffering, acknowledging that something like a diagnosis of bowel cancer does unfortunately bring with it suffering, that might be around treatment, it might be about worries about the future, and that is unfortunately a key part of human existence. That's something that we can't unfortunately escape from. Because of that, our emotions are normal, and we should be non-condemning with ourselves, try to be as supportive with ourselves as we might be with other people. So another reflection that I would offer you is that often people are very kind to one another, but struggle to extend that to themselves. That's why at Maggie's we often do a lot of our support, and I think Bowel Cancer UK are similar in this, actually bringing groups of people together, because in a group you will often express compassion and empathy to somebody else much easier than you might do it with yourself. So one of the challenges is how do we bring that compassion and empathy that we have for other people back to ourselves? And we can do that by sharing our thoughts and feelings with other people, moving away from that isolation, those feelings of being ashamed or embarrassed by what's going on in our lives. So living well with bowel cancer, I think what is important for us is to find a way to live as well as you can, given the limitations that you might face because of diagnosis and treatment, in the way that you want to. So doing what matters most to you, despite the thoughts and feelings that you may have. That second quote on the slide in front of you is from Maggie Kasich-Jenks, who came up with the idea of Maggie's Centres in the early 90s. So she talked about the challenge for people who are affected by cancer was to not lose the joy of living through the fear of dying. To think about that in a very practical sense, and this relates to psychological research that shows us that people cope best psychologically when they engage in medical care that they choose, whilst they carry on with as much of normal life as possible. So you'll see within that there is a balance to be found for each person, that we cannot just carry on normal life as if the diagnosis and treatment wasn't happening, but equally that cannot become the sole purpose of our life, because there are other things which will be important to you. That will differ between all of you. That might be roles that you have, it might be interests within your lives, the passions and the places that you have had enjoyment from previously in your life. There's a challenge for people who are affected by cancer, which is how do you carry on doing that stuff when you are significantly affected, perhaps by the illness itself, but in particular by treatments, which can be a little bit disabling? And sometimes that means tweaking some of those things. One significant barrier, I think, to people coping well psychologically with cancer is around fears of recurrence and progression. So this is where somebody is either worried about cancer coming back, so that might be somebody who has had treatment, so it might have been curative treatment or treatment to stabilize their disease, but then currently not having treatment, so they might be worried about cancer coming back, or somebody who is having treatment indefinitely, so that might be chemotherapy in particular, and they're particularly worried about their cancer progressing. Now, we know that this is extremely common. So the research on this one tells us that 90% of people who have a cancer diagnosis will experience the fear of recurrence. I often think that the 10% of people maybe who are sort of saying that they don't experience this worry may have just read the question the wrong way around or something. Generally in my work, everyone can at least acknowledge some level of worry or fear about this. There's obviously a spectrum with that. Some people are much more preoccupied and will need much more formal psychological support around managing that fear. Often that this fear is a product of the risk of recurrence, of the risk of recurrence or progression. So it's important for us to acknowledge that for people who are affected by cancer, there's a reality to some of these fears and worries, that they are often being followed up. They're having scans, blood tests that are about the risk of recurrence. And that's often where the fear comes from. There's many triggers to this fear, and it can be as simple as TV adverts, it can be storylines on TV, it can be friends and family asking you how you are, it can be adverts in magazines. So there's many things in our world that are related to your experience of cancer that will often then trigger a fear of recurrence. But there are ways of managing this. I would argue that the most important thing for somebody who is experiencing a fear of recurrence is actually around being aware of their follow-up or surveillance processes. Maybe having a chat with your cancer nurse specialist and having a talk about what processes are in place to manage that risk of recurrence. What is the logic and rationale between how often those tests and scans are done? And if you were to start experiencing perhaps signs and symptoms, what would your nurse and your doctor really want you to be looking out for? What are the things that they want you to be sort of aware that if they happen, that you would give them a phone, okay? So it's almost making yourself aware that there is this system in place to protect you. You do have a role within it, and talking to your nurse and doctor can be really helpful to understand what your role is, what they'd like you to do, and what they would like you to do if you do start to experience a change within the body. And that can actually be really, really helpful. I often think there's an analogy here with walking a tightrope, that if we were to do that without any safety features, or we weren't aware of the safety features, perhaps wearing a harness or there being a net below us, that would be an incredibly anxiety-provoking thing. However, if we do it knowing that we're wearing a harness, that there is a net below us, suddenly walking the tightrope feels a little bit more comfortable. It's still tricky, but we feel that we're being supported. There's a little bit of a backup here for us. Generalized anxiety. So this is the idea that because there is so much about a cancer diagnosis which is threatening, that often it can just raise our baseline of anxiety. So all of us will just have a baseline level. It will differ between some of us, which just reflects our personalities and other things going on in our life. But I think what we can say is that that will generally creep up for most people who receive a diagnosis. So the other cause of that as well can be that our confidence is reduced. And I think there's many reasons that that happens. I think the main one is actually that confidence and self-esteem is something which is, we can think of it being a little bit like a petrol tank in your car. And you need to fill up your petrol tank in your car every now and then. And if you don't, obviously the car runs out of petrol. Our confidence and self-esteem is the same. So when we are healthy and we're just engaging in normal life and maybe cancer's not a part of it, we're often doing things which sustain our confidence, well-being, self-esteem. So that might involve going out to work. It might be the social roles that we have, looking after the kids, the grandkids, seeing friends and family, going to the shops. Just normal everyday activities will constantly be helping us to just top up that tank of confidence and self-esteem. A cancer diagnosis, and particularly moving into treatment, often means that you have less access to those things which sustain your confidence, but also you are placed in the role of a patient. And often being a patient means taking on a slightly more passive role than most people might be used to, being very accepting of what's going to happen, long waits in hospitals, all of those sorts of things. And you might also be physically very fatigued, tired, nauseous, those sorts of things, which might make it difficult for you to just assert your impact on the world. So confidence, again, can reduce. We might see that there's two main ways of approaching this then. One being that actually we need to think about that baseline and maybe take things out of our lives which just are also adding to the baseline. So that might be other stressful life events that might be happening around us. It might be certain roles that are quite stressful. We might choose to step away from those for a while. And also doing things which are good for our psychological well-being. So activities that we find enjoyable, relaxing, those sorts of things. And that's a dynamic challenge as well, where you could be doing it over a long period of time, but there might also be times within your experience of cancer that you choose to put more coping strategies in place or reduce that baseline of anxiety. So in particular around follow-up scans, we know that people's anxiety is generally going to increase around that time. So it can be really helpful at that point, maybe for 2 weeks before, 2 weeks after, of trying to reduce other things which might be stressful for you. So that might be having a conversation, if you're back at work with your employer, your manager, about reducing demands on you, maybe not doing other things. Holidays, I think, are perhaps things we might choose to avoid around that time. We might find it hard to engage in them, and we might feel a little bit more comfortable being in the safety and security of our own home. And we might also choose to move towards activities that increase our confidence, but we need to do that gradually. So don't jump back in the deep end, but ease yourself into the shallow end. So stepping a little bit outside of our comfort zone, and also recruiting other people to help you. So loved ones that help you feel a bit more confident about yourself, engage them in helping you. So take them with you to certain things, and that should be helpful. Identities and roles can be really, really important. Again, I think this relates to that idea of confidence and self-esteem. So our ability to fulfill these roles is often reduced. That can create a lot of sadness, a sense of loss that we're not able to work at the moment, that we can't look after kids, grandkids, those sorts of things. And you might not feel comfortable being a patient. Often I think being a patient comes with some labels that we might feel uncomfortable with. So I often think some of those labels, such as a cancer victim or a cancer sufferer, are quite uncomfortable, and they come with sort of added meaning to them, which might not sit comfortably with you. You might not identify as that type of person. So this can create really complex feelings, perhaps anger, frustration, sadness. I think this is about trying to stay connected with the roles that we've had in the past. So doing what we can, even if it's not quite the same. So if we had a role in the past, doing something which is an expression of it, an adaptation of it that you can manage given your current limitations. Your relationship with your body and appearance can change really significantly, I think, because of cancer. Really complex feelings can arise out of those changes. Issues around trust. So we often trust our body until something goes wrong with it, and then it can become quite complex, that we might become quite worried about just normal signs and symptoms that we have in our body. We might become very questioning about. So often that pain in the side of your knee that you wouldn't have thought anything about, now you might worry about what that means. Is that recurrence? Is it progression? Those sorts of things. We might dislike changes to our body, so things like scars or stomas, and our body might become unpredictable in a way that it hasn't been before. So that can be things around fatigue, tiredness, nausea, but also the management of things like stomas can be unpredictable, particularly at the start as we're getting used to them and building a new relationship with that part of our body and how it functions. I think with this, it's really important though that we acknowledge that our feelings around our body and our appearance are not simply about how our body looks. It's not simply about an aesthetic. But actually scars, stomas, how our body functions, what's emotionally challenging about them is more about what they represent to us, this illness or vulnerability that we're often experiencing. Relationships are really significantly impacted by cancer because talking about cancer is complicated. We're not particularly good at it, I would say, as a society. Some of the stories and narratives we have can be unhelpful. Telling one another that we must stay positive as a golden rule, or that we need to battle things, can be unhelpful. It's important, I think, acknowledge that professionals receive lots of training on how to talk to people who are affected by cancer. But patients don't really receive any, to be honest. They're expected to be given this life-changing, life-altering diagnosis, and then go home and tell other people what's happened, communicate very complicated pieces of information. Out of this difficulty often comes that desire to wear a mask, to avoid that discomfort. So we wear a mask, that cuts us off from other people, and often then conflict can arise, particularly if we're very focused on perhaps not listening to each other. I would say that's the number one challenge. The first step in communicating better and developing better quality of relationships around cancer is actually listening to each other. Often we're caught in thinking, what do I need to say to this person, rather than hearing what they're saying to us. So bringing us back to this model, how do we care about our psychological well-being? Acknowledge what is there. Try to drop that struggle with what is happening for you emotionally. You may be caught into patterns of perhaps pushing it down or wearing a mask, but often that will unfortunately have an unintended consequence of making things a little bit worse. Open up with other people, whether that be professionals or loved ones. Try to understand what's happening, and that will hopefully then help you to find ways of coping. So doing this proactively, try to put things in place before problems build up. So think about your emotional well-being today and what you might do, the small steps which will hopefully help to improve your well-being. Peer support, I think, can be incredibly helpful because it will normalize the experiences that you'll have. You'll hear other people talk about the challenges that you face, and that can be such a powerful thing. I see that on a day-to-day basis. It's a privilege to be involved in it, and I often sort of recognize that actually there's more value in those connections and relationships than perhaps the work that I might do directly with somebody. In terms of how the NHS can support you, they talk about there being 5 key principles of good mental health. So this is the proactive stuff that we can all be doing before a crisis, during a crisis, that will help us to just manage. So connecting with other people, being physically active. So exercise is a wonder drug that has no side effects, but can help us both physically and mentally. Learning new skills will help with confidence. Giving to other people can help challenge that sense of our confidence having been reduced, and perhaps the value that we see within ourselves. And paying attention to the present moment, which can be really challenging, I think, for cancer patients who are often worried about what the future might hold for them. And it can be a bit of a skill that we can learn to practice and put into place. Take action. So think about what you value within life and turn those things into goals. Try to make changes in areas in your life that are within your control. So there's that aspect, isn't there, of acknowledging what are the things within our lives that we can control, what do we want to be different about them, and how may we make that happen. When we face those difficult thoughts and emotions, notice them, acknowledge them as normal, and refocus your action on those things that are important to you. Other sources of support around psychological support. Your medical team, particularly your cancer nurse specialist, can be really helpful. Your local Maggie centres, so we have 24 centres across the UK. You can go on our website to find your local centre, or you can phone our main number. They will tell you where your closest centre is and help connect you with them. Macmillan Information Centres also can be really helpful, particularly as a first port of call to just find out what's available to you in your local area. And local mental health services such as primary care mental health. So you'll see there's an acronym there, IAPT. So IAPT stands for Increasing Access to Psychological Therapies. That is a service for people who are experiencing mild to moderate anxiety or low mood. and they have recently increased their remit to include all people with long-term conditions, including cancer, and they are receiving extra training, supervision, support around supporting those patients. And that can be, they can be quite easy to access services, so you don't need to be referred into an IAP service. You can just find yours by going to NHS Choices and just do a little bit of searching. Lovely. Any questions? We've got the Q&A box, don't we?
We have. Robin, thank you so much. And in trying circumstances in the background.
Yeah, I hope nobody heard that.
No, you styled it out beautifully. We had no idea.
Good.
So obviously, and quite understandably, we've got quite a lot of questions coming through here on quite big subjects. So we're going to sort of group them together in themes. So first up, we've got a lot of people, and we know that from our forums, a lot of people ask this question too, about coping with scanxiety, you know, that anxiety ahead of a scan. So what tips would you give people in that situation?
What I would say is, I mean, overall, I think that it's a learning process, that particularly those first few times that somebody is going through those follow-up scans, the anxiety is probably going to be worse on the first few. But what you will hopefully do is be learning from them about what works for you. So I think be reassured that over time, you will come to find what works for you with further ones. So if you've had one recently, there can be a tendency, I think, to sort of, right, it's behind me, let's forget about it. What I would say is actually, let's think back to it. What did work in terms of reducing your anxiety and coping with the anxiety? What didn't work? And then think about that actually being the formulation for a plan for next time. What I would also say is that think about it not just being a single time point, that what you'll generally see is that there is a lead up to a scan, and the time period will differ for different people. For some people, it might be a week, for some people, it might be 2 weeks, and for some people, it might even be a month, where their anxiety will be increasing over that time period. You'll then have the scan, and then the anxiety will perhaps be at its highest point as you're waiting for the results of the scan. Yeah. And then when you come off the back of it, unfortunately, the anxiety tends not to just switch off like a switch. And actually, what we know is that anxiety takes time to resolve and recover. So think about that period of time. So from the start, as the anxiety is increasing, all the way to the point of that recovery of what's going to help with you. As I said in the presentation, reduce other demands on you, recruit other people, make them aware of what's going on. Relaxation strategies, distraction can be really helpful. Those short-term coping strategies in particular can be important just in the lead up to scans.
That's really helpful. Thank you. It sounds like the message there is plan for it. Use the past experience and plan ahead because you have a sense of what might be coming.
Yeah, absolutely.
Yeah. Robin, we've also had a question in the you might have seen in the Q&A box from somebody who's talked about she's stage 4 and found it really hard to have been given a 2 to 3 year life expectancy, and is doing incredibly well and better than her oncologist ever imagined, which is great news, and she's very positive about that, but can't help thinking about that statistic and how close that sort of arbitrary 2 to 3 years is getting. How do you deal with that?
I think it's really hard when people have those timescales. Either they've maybe asked for them or been given them, and often it's really difficult because, as we know as professionals, those timescales it's a very difficult part of medicine to sort of predict that sort of prognostic information. So I think in some ways we can undermine that a little bit and say it's probably not good quality information. I think as well, once you do have that kind of line in the sand, so to speak, what can be helpful is actually to start doing things, maybe start actually planning things which are past it. That can actually be really helpful because you're undermining it as a deadline, so to speak. It reminds me of, I'll share this as an anecdote because I think it was a beautiful way somebody captured it for me. He was very unwell, not bowel cancer, a different type of cancer. And he said to me to capture what he was going through, I need a new toothbrush. Current toothbrush looks horrible. I don't want to buy a new one. So I say to him, well, why would you not want to buy a new toothbrush? He said, because it could be the last one. And that then led on to a conversation between us about the meaning of buying that next toothbrush, that yes, it could be the last one, but that shying away from doing it, what was the cost of it? So it meant he had this horrible toothbrush. It wasn't what he wanted to do. It wasn't in line with his values from the past, which were about looking after himself, good dental hygiene, those sorts of things. It was a respect for himself, actually. So for him, it meant sort of acknowledging that it felt a bit anxiety provoking to buy the next toothbrush because there was a risk it could be the last one. So I think in this lady's case, sometimes it can be helpful to do some of that planning for past that time scale. But what I would say is that often that does come with a bit of anxiety of, am I going to be able to achieve those things? And that's where there's a little bit of courage to be had, I think, actually. But it can be helpful to take the risk.
And it puts you a bit more in control.
Absolutely. Yeah.
Robin, that's really helpful. Now, there are a couple of questions we haven't had a chance to get to, but I've been looking at the chat, and I think that a lot of it has been picked up by the information about where to go to get that support, which is so crucial, isn't it?
Absolutely.
And particularly if, not everybody can afford to pay for private sessions. And so there's a load of information in the chat if people haven't seen it. And if we haven't specifically answered your question, the team will get back to you.
We will get back to you on it. So unfortunately, we have come to the end of our time slot, Robin. Thank you
Not a problem.
so much for taking us through your presentation and covering some really tough topics this afternoon for us, but we can tell from the chat how valuable people have found it. So for another virtual round of applause for Robin.
It's been brilliant. Thank you so much, Robin.
Great. Thank you very much. I will go and rescue my wife now.
Absolutely.
Bye-bye, everyone.
Bye-bye.
Bye-bye. Oh, that was fascinating, wasn't it?
It was really helpful, really informative.
So important for people to be able to just have space to talk, and I saw there quite a few comments from people saying, my family are struggling with my diagnosis and I don't feel able to share my feelings as a result of knowing how upset they are.
Yes, taking on someone else's upset can be really tricky.
It really can. So I'm so grateful to Robin for that, and I know we're going to get him back for more, aren't we?
Because will. Yes.
Just seeing how much people really value that is so important. But talking about getting people back for more,
yes, shall we?
Our next guest our next speaker is the fabulous Dr. Philippa Kaye, who I've had the pleasure of talking to around your brilliant book, Philippa. Doctors Get Can you see that, people? Doctors Get Cancer Too. And we've had a couple of chats on Facebook Live, haven't we, already, about what it's like to get a bowel cancer diagnosis, and also about well-being as well. And again, something that really resonated with our community and people who wanted to know more. So I'm so delighted that you've given up some of your Saturday to come and join us again today. How are you?
I'm good, but is it just me who would have bought 2 toothbrushes? I thought what he was talking about was amazing, but I would have gone, all right, I'm going to buy 2. Then it can't ever be the last one.
That's exactly what I was thinking.
Not to make light of a wonderful anecdote and a really difficult situation and story, but for me, the answer would definitely, why buy 1 chocolate cake? Buy 2 toothbrushes.
Ooh, 2 chocolate cakes.
Oh, now we're talking. Oh, Philippa, welcome and thank you so much. Now, I don't know if you've been able to join much of the rest of the day, but we've had some fascinating discussions, and a couple of the questions that actually came up in different sections that we didn't have time to talk about, we were hoping that we'd be able to talk to you about, because we know that it's an area that you'll be able to cover brilliantly. But before we get to that, Catherine, what was it you wanted to say?
Well, welcome, first of all, and
Thanks for having me.
That Jen said about, thank you for giving up some of your time on a Saturday. It would be really helpful, I think, for everyone listening, if maybe you could just give us a sort of potted history, if you like, of your bowel cancer, just so everybody listening kind of can understand what you've been through.
Sure. So my name's Dr. Philippa Kaye. You guys might have seen me on This Morning or on other television or radio shows. I am a GP and a mum of 3 kids. I have a husband as well. And I was 39 when I was diagnosed with bowel cancer, entirely unexpectedly. Lots of us are, but I didn't have the classic symptoms of bowel cancer. And it was stage 2. I had a partial resection and followed by 6 months of chemotherapy, at the end of which I got to that point when everybody says, okay, we're leading up to the bit where you're all finished. And unfortunately, the scans showed that there were more lesions, and all of that culminated in many more procedures and whatever, and ended up in the middle of the pandemic last year having an enormous operation and chemotherapy inserted into my abdomen and various more bits of different kinds of bowel and different things removed. And that was 10 days in ICU in the pandemic on my own, 2 weeks in hospital altogether. But after all that, I'm very grateful to be told that currently there is no cancer to be seen. So that's where I am now. And I am so fortunate to, as part of my job, be able to explain to the public and people about health and looking after themselves and all those public health messages that we deliver through the media. And for me, what's really important now is to deliver what it's like to be somebody who is a young adult with cancer and the concerns that we might have, what it's like to live with cancer, what it's like to live after cancer, because that can be exceptionally difficult too. And for lots of other people, I think they say, well, you're done now, it's all better. And it isn't. And there is work to be done both physically and psychologically afterwards. And I hope that I can use some of the platform that I have to help others going through the same process or help others understand what their loved ones are going through.
Mm-hmm. Really, really, really important, that kind of how to have those conversations actually, you know, with your family when everybody's anxious about the diagnosis. And, you know, I mean, how do you start? You talked about, you know, you've got 3 children. How do you start to have those conversations with them when presumably that diagnosis is still quite raw for you?
Yeah, so apologies if anybody out there has heard this story before, but it's still really raw for me, actually, is that I spoke to my husband immediately after I was told that I had cancer, and I knew he was going home to the children, and I said, wait for me, we'll decide what we're going to do. And we have always been very honest with our children. And I then had to go and have a CT colonoscopy, which is where they put air inside through the back passage, and because they couldn't get past the blockage on the colonoscopy, and to see whether or not there was spread. And I phoned my best friend, who's a child and adolescent psychotherapist, naked in the changing room on the floor. And I said to her, I need you to be professional. I need you to keep your wall up for a minute. I'm going to tell you something, and you can't fall apart, because if you fall apart, I'm going to just stay here naked on the floor. Tell me what to tell my children. And she was marvelous, I have to say. I then texted her husband at the same time going, someone better go and pick her up because she's going to be a mess now. And what we agreed, my husband and I, was that honesty was going to be the only way. Mm-hmm. And I firmly believe that you can explain everything to children in an age appropriate way. I mean, when my sort of eldest was 2 or 3, they asked how the baby got into the tummy of the person over the other side of the road, and you can say it in an age appropriate way. And so I remember coming home, and we sat at the top of the stairs, and we said that mummy's got a growth in her tummy that's called cancer, and it's a growth of bad cells, and mummy has to have an operation to get it out, and mummy's going to be very tired because all her energy is going to be going into healing her body, and that afterwards she might have to have a medicine called chemotherapy, and her hair might fall out, blah blah blah. And they reacted in the most age appropriate ways. The then 4-year-old said, who's going to take me to school, because they can't see outside of sort of their own lives. The 6-year-old automatically went over to give me a hug and then recoiled, saying, you can't catch cancer, can you? And then said how interesting and fascinating it would be to see me with no hair. And the eldest one wanted to talk about a situation that he had in a book where a parent had died from cancer. And I think that the whole way through, being honest allows them to be honest back. So when they say to you, "Are you scared, mummy?" I would say yes. In fact, when they ask me that now, I say yes. And they say, "What are you scared of?" And I would say I was scared of pain before the operation. I was scared of being alone. I was scared that the cancer will come back. And what I didn't do was say, "No, I'm not scared." Because if I said, "No, I'm not scared," that doesn't give them permission to say back, "I'm scared too." And so what they would say is, "I'm scared too, mummy." And often they didn't know what they were scared of, or they couldn't voice what they were scared of. And I definitely couldn't fix what they were scared of, because from that day, May the whatever, 2019, I've never made my kids a promise ever since then. And I can't do it. I can't promise them something because I don't know whether or not it's going to come true. So when they said to me that they were scared, I said, "Me too." And we sat there together in it. And that's all you can do. And that is often enough. You allow them the space to be scared, or the space to be furious. I remember my eldest said, "I want to say a really bad word," and we let him go in the car and say all the bad words he knew, and he thought it was marvelous. And giving that permission and then sitting in that space with them is really important. It definitely still is in our lives, and when I say our lives, I mean all of the lives in my household now, in that I had to have a blood test a couple of weeks ago, and the question was always, as soon as they saw the plaster on my arm, "Is the cancer back? What's happening, mummy? Are you going away?" And whilst our kids are really resilient, and whilst my kids will have learnt lots of things over the past 2 years, it's still in their lives too.
Yeah, but they have that, they know that nothing's off limits, that they can talk to you about whatever is in their mind. And
I think that's really important. But I also think that as the person, what that means is sometimes it's impossibly hard, because children are very honest. And so I came home from hospital, and the middle one said to me, "Mummy, I think it'll be fine if you died, because I was all right when you were away. Daddy was here and Grandma was here, and lots of people came, and I got loads of chocolate. It was marvelous, and treats and all kinds of things. And I think I would be fine if you died." That was incredibly hard to hear, incredibly hard. I was terrified I was going to die. I still am. And what he was saying, he was not trying to hurt me. All he was trying to do was reassure himself and tell himself out loud that he was okay. And yet he still needed me to do that, because he needs that, because he needed his mother. And so you have to be prepared to sort of deal with sort of things that kids say, which aren't meant to hurt you, they're meant for themselves. And the other thing that I think is really important when it comes to dealing with children is understanding where they are developmentally. So young children under about 7 or 8 have what we call magical thinking, where they believe in the power of themselves because magic exists, which is wonderful. So the tooth fairy exists, and everything, you know, all those other fabulous characters exist. But it also means that they can say, "I was cross with mum or dad because they made me tidy my room and I wished they would go away. And then this happened. Did I do it? Was I naughty? Did I do this?" And actually having an understanding that that might be something that they're thinking means that you can then preempt that conversation when they are fuming and say, "Do you know what? This isn't your fault. You know what? You don't have this power. I don't even have this power. None of us have this power." So I think that understanding why a 4-year-old might say, "Who's going to take me to school?" and a 12-year-old might go away to his room and not talk to you for about 4 days. Both of those things are developmentally appropriate, and understanding that none of that is actually about you and all of that is about them is really important. And whilst we can do that potentially for our children, it's exceptionally difficult for us then to have the emotional energy to do that for the other people in our lives, be that our partners or our parents or our friends or our families, because we've given whatever we had to ourselves and then potentially to our children. And it is really hard to deal with the emotions of everybody else.
I think that's fascinating, and I think that sort of leads me to a question that I had, having read the book, and you talk a lot about your husband and the importance of the role that he's played you know, in supporting you and the family and holding everything together. And we've had quite a lot of questions today from people around managing the impact of a cancer diagnosis on their relationship with their partner, wife, husband. So how did you cope with that? What were the things you would recommend that somebody else really tried to hold on to?
So I think that it will all depend on your own personal relationship. And in mine, I was always the medic because I am the medic and he's not a medic. And so when something would happen with our children, he would look to me always. And if I had it together, he was fine. And if I showed fear, he did not like it at all. And then suddenly it was about me. And I think that when things were sort of a little bit better, or when I was a little bit stronger, that to give him the space to discuss his emotions, but for him to have somebody else and other people and to be able to pass out. So there's the concentric circle theory or the snail theory, which is the person going through the trauma, whatever the trauma is in the middle, and they pass their concerns, their feelings outwards, and then those people don't pass them back in. They need to pass them out and out and out. So you tell your partner, your friends, your parents, your siblings, whoever, right? And they then go and tell their partner, friends, siblings, who then, and by the time we're 6 circles out, we're at somebody who lives 300 miles away from you going, oh, a friend of a friend of a friend of a friend's got bowel cancer and she's a bit unhappy and blah, blah, blah. And they're like, all right, I'm sorry. And so that sort of diluting effect helps, but it's about not passing it back into the person. So I think that it's really important that everybody has their own support networks that aren't each other, but sometimes to allow each other to fall apart together, because again, you can't fix it, but you can be in it together because they're sad too. And this isn't a competition. No kind of grief, no kind of trauma is a competition. It's not, it's worse for me, it's different for me. So you might not have the physical pain, or you might not have my level of whatever. It doesn't matter. Your pain is your pain. And sometimes we need to cry together. And that's okay. But I do think that everybody needs to ask and get their own support. And I also think that for all our friends and family, they need to ask about the partner. So when they ring, right, they ring the house phone or whatever, or they ring the doorbell, that not to say straight away, how's Philippa? How are you? Doesn't take much. Is there anything I can do for you? And I always say that you need to ask those questions twice, because the first time is what we call phatic speech. Hi, how are you? I'm fine. No one actually is fine at all. I say that all the time in my doctor's surgery. I say, hi, how are you? And they say, I'm fine. I'm like, why are you here? So the first time is phatic speech, just sort of passing the time. And it's that second time that is asking the question, how are you? I'm fine. No, really, how are you? I'm here if you need me. And I think that second or third time is important, but so that when you do see the partner or the kids or whatever, just acknowledging that they are going through a trauma too can be really helpful.
Yeah, I think that is fascinating, actually, that asking twice. I mean, the theme of our day actually is how are you? And we started off by asking that question first thing. We've had lots of people posting in the chat how they're feeling, and obviously it's a real mix of emotions. And I'd quite like to touch on a comment that we had earlier on a different session, where somebody was saying, obviously you're a medic, and we had somebody else say, if you've got that medical knowledge and then you find yourself being a patient, how do you manage that? Because of course you are several steps ahead because you have that knowledge yourself, but that can also be really hard to deal with, right?
Yeah. So I did a radio interview on 5 Live with my bowel surgeon, and they asked this question to me, and I said, oh, you better ask him how I was as a patient. And he laughed and then didn't say anything else at all, which I thought was hilarious. So I think that it has definite pros and cons. The biggest pro for me was that hospitals are places of safety for me. They are not somewhere to be scared of. And I think that for lots of people, the hospitals are a terrifying place where only bad things happen apart from having a baby, right? But for me, Hospitals are a place where people come together to do everything that they can to make you better. And I've experienced that on the other side. And so I know that, and I know that somewhere very deep down. And so I didn't ever feel unsafe or scared going into hospital. I also understand what I call medicalese. And actually, I feel comforted by that because that's my language. So you can talk to me and use all the terms that you like, and that's great. What isn't great is that I cannot turn off my doctor head, and I cannot turn off the training. And the training is always worst case scenario, always 3 steps ahead. If this doesn't work, what we're going to do next, what we're going to do next, what we're going to do next. When you're a patient with cancer, you can't do that. You can only live in the now. And I think that lockdown has given lots of people an experience of living in the now, but we live in the now, and the now might be 5 minutes and it might be till the next scan, but we live in the now. And I could never turn off the part of my brain that was always 3 steps ahead, and that included in ICU. And, you know, there would be times when my heart was doing something funny, and I would look at the screen and my brain would be saying, okay, someone's going to come in and they're going to do X, Y, and Z, and I'm going to get this drug and that drug. And if that doesn't work, that's okay, because there's the next. And if that doesn't work, that's okay, there's the next. But my patient part of my brain was just screaming, you're going to die now. And those 2 things were really difficult to balance. And the other thing that was really difficult is that doctors have this idea, entirely incorrectly, that somehow or other we should be superhuman patients, that somehow our medical knowledge should protect ourselves, but our bodies are our bodies, and we're just the same as everybody else. But I really didn't want to bother anybody. And so I never treated myself. I never prescribed for myself. That's against the GMC guidance. Of course, I didn't do that. But there are things that we can get over the counter. And also, when you have chemotherapy, they give you a bag full of drugs, right? You feel sick, take this. You still feel sick, take that. You're constipated, take this. You've got diarrhea, take t'other, right? And so you've got a whole shopping bag full of medication. And so I think that I probably initially, at least for the first half of my chemotherapy, I didn't ask for help as early as I should have. And that I went, okay, I feel X or I have Y, I'm going to do blah, blah, blah. And that I should have been ringing much more, saying, I'm doing this, is this okay? And it was only when things were going really wrong that I then began to ring and say, I'm not managing and I've done X, Y, and Z. And they said, well, of course, so now you ring me. But it felt very much at the time that I should be able to do more somehow. And I had to learn that by trial and error, I guess, that actually what I needed to do was ask for help more. And I know that as a doctor, because we say all the time as medics, if anything happens, you need to contact us. As a patient, I found that very difficult. So yeah, there were definite pros and cons of both.
But it's fascinating hearing you say that, and you're a doctor, and you know that you would want you to ring.
Yeah.
Yeah. And you know that, so it must be.
I know exactly why it was, actually. It was because not just the doctor sort of needing to be super patient bit, but I had entirely incorrectly, you'd go to therapy to work these things out. I had this idea that I had to finish chemo at the top dose to have the top effect. And that if I didn't do so, somehow I wasn't being the best patient and I wasn't giving myself the best chance. This is not true. And I am a member of a doctor's support group, and one of them went, they're not trying to kill you with the chemotherapy, Philippa. Like, they're trying to keep you alive. Go back. And it took somebody being as blunt as that to say, they need to keep their batting average up here. You're not supposed to die from chemotherapy, to go, oh, I'm doing this wrong. And I think that there's this idea in the public sort of minds that chemotherapy should be horrific, and that we all must be sort of hanging on to the toilet bowl and cachectic and look awful and feel awful the entire time. And that isn't true. And yes, chemotherapy is terribly difficult. Of course it is. But that doesn't mean that it should be agony. And so, getting that balance. And when I said to the oncologist, I can't, my hands and feet are falling apart, I can't walk. And he went, all right, we're going to do something else. And I said, but if you reduce the dose, which they tried to do first, they tried to reduce the dose first before I changed to intravenous chemo. I was like, but it won't work. And he said, no, it's working too much. That's the whole problem. It's not just killing off cancer cells, it's killing off everything. It's too much for you. We need to do a bit less. And I didn't understand that. And I say that as a medic and a person, I didn't understand that it would still work anyway.
That's really interesting. And that really chimes, doesn't it, with what Darren was talking about in our first session of the day, where we were talking about the side effects of bowel cancer and treatment, and he was talking about that, about the importance of learning to ask and learning to say when something is causing you an issue, because there is a solution.
Yes, you shouldn't have to put up with that.
Yeah, absolutely.
Yeah, and I think that having cancer has taught me lots of things as a person, but also as a doctor, and how I am with my patients has definitely changed too. And I would put that bit as a pro, in that I understand much more that the fact that not everything can be fixed isn't a failure on the part of medicine. It's just life. And that actually, as a patient, we're often not asking our doctors or our medical teams or our nurses or whoever to fix us. We're saying, this is happening, just hear us. And to be heard, to be seen is hugely important. And to be able to sit with my patients now and say, you're having a really difficult time, as opposed to automatically going with the sick note or the painkiller or the whatever medicine, or, you know, the support group or whatever, to try and fix it, to just say, you're having a really difficult time and I'm here, is hugely valuable, I think, because and I see that on my patients' faces. I see their eyes come up, and just for a minute that somebody connects, that somebody says, okay. And so I think that there's definitely stuff that we learn both ways. And I think that there is still a long way to go in the realms of medicine for understanding what our patients are going through. And I think the GPs are often in the best place to do this, because we have the most holistic understanding of our patients. I know where you live, which sounds tremendously creepy.
That sounds a bit threatening there.
I know, but I know your family, right? I know what you do. I know where you live, and whether or not actually, you know, if we're saying you need to, I don't know, eat X, Y, and Z because we've had half of your bowel removed, but you can't because there isn't a shop, or there is a shop, or whatever. And yet, we don't really, in hospitals, definitely talk about what it's like to live with the after effects of bowel surgery, with the effects of chemotherapy, what it's like in that first 1, 2, 3, 5, you know, I hope to get there years after you finish your treatment. And actually, I think that we need to be talking about those things and learning about those things an awful lot more, and that as a medical profession, we can only learn that from our patients, and then we will be able to help those in the future far better.
You know, it's interesting you say that, because we've had a couple of comments in the chat while we've been talking, but also earlier on in the day, about the whole sort of be strong narrative. You know, you must be strong, you're kicking cancers, what's it, you know, all of those sorts of kind of
beating cancer.
Yeah, those
that narrative.
Those sorts of things.
Yeah. So I think that if we can't say beating cancer's butt when we're in the bowel cancer world, we can't say but anyway, so we don't really get to say that. So I think that there are narratives which, when we are patients, become very difficult. And the first is the battle. And I'm somebody that thinks very carefully about my words. You know, I speak in the press, and I speak in sort of in the media world, and I'm very careful with the words that I say. And battle, or at least I try to be, I'm not always, because none of us are, but I try to be, but battle implies that there's a strategy, right?
Yeah.
And it implies that someone can win or lose, and that whether or not you win or lose depends on the strategy that you take. That isn't true for cancer, because I didn't go to war with my body because they're trying to annex another limb of somebody else, right? It's something that happened. And I didn't make the strategy as to how we're going to win either. Somebody else did. And then at the beginning, it actually felt very passive. It was also quick, and and it felt very passive. This is what's happening to me. And then when I went in for chemotherapy, actually, you're very submissive, and you sort of lie there, and someone comes and shoves a great big whopping needle in your port, but you lie there, and that didn't feel anything like what I imagined a battle to be. And also I could not come to terms with the idea that I might lose it. I wasn't ready for that. I'm still not ready for that. And I couldn't be put in a situation, and I think that the term battle or fight implies that there can be fault if you don't win. Yeah. And this was never my fault. This was my cancer. It was not me. And I had to separate those two. So I struggled with the word battle or fight. I then really struggle. I struggle now with the word survivor, because sometimes it feels like I didn't do anything. And sometimes it feels like it was the hardest thing that I ever did. But, you know, the word survivor also implies that it's finished, and it's not finished.
Yeah.
I don't know when it's going to finish, but it's not finished right now. And I have lots of issues from the surgery, and you know, and I'm still in active surveillance, and I'm seen every 3 months, and they don't think it's finished. How can I think it's finished? And I really struggle with be strong. The emojis of the arm like that, and you know, and the your country needs you poster, and you can do it, because I didn't feel strong. It did not feel strong, and I didn't feel brave. I felt frightened all the time, and I felt fed up, and I felt angry, and I felt sad, and I was glad when I felt angry, because anger was this positive, powerful emotion that didn't feel as exhausting as sadness did. And I did not feel brave. And so what I say, and I only came to realise it was about October, November, and I was sort of 4 months into my chemotherapy, and a patient said to me, I don't feel brave and I don't feel strong. And I said to her, do you know how I know that you are? Oh, I'm getting all upset. I said, do you know how I know that you are? And you can't hear it, but I know that you are, because you keep going anyway, and that you don't have to go in skipping and laughing and joking, because it's not fun. And you don't have to go in saying that I'm grateful for the opportunity to have chemotherapy, because although you are, it sucks. And you don't have to go in saying I was sent this for a reason because I can cope with it, because it's not fair.
No.
But you go in anyway. And it is that determination, and it is that persistence, even if you're dragging your feet, even if you're stomping your feet, even if you're raging the whole way, it is that persistence which is where the strength is. And it was only in telling that to her that I began to think maybe somewhere that applies to me. And I still struggle with that, because at the time, or even now, none of us feel strong, but we don't always have insight into what's going on. But what I think that we should be doing as the friends and family of somebody with cancer is not telling them that they're strong, is saying to them, how do you feel? And so that when they say, I don't want to today, you say, yeah. I don't feel brave. Yeah, I hear you, I see you. And that's it. Because when you say, I don't feel brave today and I feel fed up, and they say you're strong, what happens is that you don't, your feelings are being negated, and you feel that your feelings are somehow wrong or not valued. And that's not correct, because whatever it is that you feel, and there are no rights or wrongs about feelings. They are just what you feel. And so I think that, hard as it is for our loved ones to hear that, to not just totally refute it and go straight with, but you are strong, you're the strongest person I know, can be really helpful for us. And if they can't do it, which is true for lots of us, to go somewhere where they can. And that might be here, and it might be with your support group, and it might be with therapy, and it might be with the one friend who can take it, but to find someone that can, because it is okay to say, I'm not strong, or I don't feel it today.
I really love what you were saying about the snail and the finding places to go, you know, basically where do you take that? And certainly on our forum, we found that there's also a specific private bit of the forum, which is for the close family of the person who's going through bowel cancer, and you know, really, really helpful place for people to go to talk to people in a similar situation. And I've got one eye on the chat, and I know that that's really resonated with a lot of people here today. And there are so many people saying thank you for sharing your experience. It's just brilliant to know, you know, you sharing how you're coping is really resonating with so many people.
So I think that often it's hard for us to identify what it is that we're feeling, because our feelings are so complicated and they're often really conflicting. So, for example, I might be annoyed by people telling me that I'm strong, but if you don't say anything, I'm also annoyed, right? And I might be embarrassed that I'm the centre of attention in the school playground when I was diagnosed, but also the people that couldn't look at me and cross the playground to avoid me, I was annoyed with them too, because it is conflicting and it is complicated, and that's what humans are. And I think that the reason that I published the book, which is my diary, I did not write this afterwards looking back, it was the diary that I wrote at the time, is because sometimes when you read somebody else or you listen to somebody else, you go, oh, me too, and then you think, okay, I'm not alone, or okay, I'm not wrong. And that's all I really want to give somebody, is to say, do you know what, you might not be feeling like I felt or like I feel, but you might be, and that's okay, you're not alone.
We've actually had that. Somebody did post in the chat while you've been talking, oh, that's great, it's not just me. To know that I'm the only one feeling this way has made a difference. So
it really has. Can I just pick up something that a question we had earlier was from somebody who, so, you know, you are you, and bowel cancer is a part of that, but it's not everything. And there was somebody earlier who said that, you know, she's going through menopause. And I know this is an area that you are particularly knowledgeable about, and nobody ever deals with that side of her. It's, you know, the whole focus is on her bowel cancer, understandably. But then how do you disentangle? Is that fatigue because I've done chemo, or is it, you know, do I need to change my HRT, for example? Or, you know, that you're a whole...
So I think this is a problem that happens with anybody that has any form of chronic illness, is that it can be difficult to work out what's going on. And that essentially is why a GP is so important, because we're the ones that know, that hold all the different threads. So you might see a cardiologist about your heart, and you might see your oncologist about your chemo, and you go and have your bowel surgeon does your colonoscopy, or, you know, whatever else. But actually your GP has got all the threads together. And it isn't easy. And often it's, well, maybe this will help, so let's try, and if not, then we're going to go for the next thing. And that's why, you know, as I said, we're always thinking 3 steps ahead. But there is definitely something about identity, and I think, you know, identities actually come up a lot here, you know, survivor or fighter or patient, or, you know, all those different, for me, doctor, patient, all those different roles in identity. And for me, I thought of my cancer as male, not because I'm anti-men remotely, just because it helped me separate it from me. And so when I wrote about it, I referred to it as he, because when you write or you talk about pregnant women, when you write about pregnancy, you often use he to talk about the developing baby, not because they're boys or girls, simply to differentiate between the she's in the book. To define, are we talking about the woman or are we talking about the baby? And so for me, as sort of the writer part of me really wanted to separate it, and so I made it male. But having an understanding that something grew in me that actually came from my genes. I have a gene. I don't have Lynch syndrome. This often comes up as a question when I talk about genes. I don't have Lynch syndrome. I have a different gene that doubles my risk of bowel cancer. And so I say, well, their cancer was separate from me, but it came from my genes, and my genes are my building blocks of who I am. That's how I explain them to my kids. I say, your genes are the Lego bricks, and the Lego bricks make the building, and you're the building, or the car, or whatever. And so that separation is really difficult between you and the cancer, and you and your menopause, and you and whatever else. And the truth is that fatigue is there for an awful lot of reasons. Even if you don't have the menopause, it's not just the chemotherapy, it's not just the recovery from the surgery, it's the psychological effects of the trauma that you're going through. And we know that cancer patients have lower levels of serotonin in their brains, and serotonin is the feel-good hormone, and when you have low levels you get depressed and you get anxious, and it affects your energy levels. And so there are lots and lots of reasons. But that's also why sometimes we throw the kitchen sink, and why we say, okay, so there is something that I can do as a doctor. Yes, maybe we can try a little bit of HRT because you're menopausal as well. And yes, I can fix your iron levels because you're anemic. And yes, maybe you need a blood transfusion. But what can you do? Okay, you can exercise. You can make sure that your sleep hygiene is good so that you try and prioritize your sleep. Yes, you can have the therapy. And so we don't just say, oh, right, fatigue, I treat that with why. We say, okay, you're a whole person, and there are lots of causes. What can we do to make it better?
Yeah, and that's why your GP is so important and such an important part of your team, because you say you hold all those different threads. Philippa, I could literally, I'd love to talk to you all day, and I mean, your talk has been amazing.
Thank you.
We've run out of time. But thank you once again for giving us some of your time. I hope we'll chat again.
Definitely. You guys know where to find me, and I really hope to everybody listening that it is helpful.
100%. I think that's fair to say, and I hope you get a chance to have a little bit of a look at the chat yourself. You'll just see how much that's resonated with people and helped people. So thank you again from us. And enjoy the rest of your Saturday.
Yes, have a good weekend.
Thank you. Have a good day, guys.
Thanks, Philippa.
Bye-bye. Thank you. Oh, that was amazing.
Yes.
The energy as well. Yeah. I mean, it's always such a pleasure to talk to Philippa, and I always learn something. And what I loved was the way she said, when you're talking to people close to you, you can't fix it, but you can be in it together. And I just loved how she said that, and also ask how you are, but ask it twice.
Yes, definitely.
And so somebody else said in the chat, actually, another good question is not how are you, but how are you coping?
Yeah.
And I think that's really, really important. So,
and I totally promise I'm not working on commission. However, Philippa does talk in her book a lot about a theme that's come up quite a bit, and that's post-treatment, it hasn't all gone away. That idea that you're still living with the effects, both psychological and physical, of your cancer treatment, and how you manage some of those issues around not wanting to tell the people around you that you're not feeling great, because they're kind of expecting that you haven't got cancer now, and so you should be feeling absolutely fantastic, and you're not. So for anybody sort of who had a question around that, I would say, get it on your Kindle or out in the library or from Amazon or wherever.
It's a good read.
It is a good read, and she definitely focuses on that in the book.
Absolutely, and this comes up quite a lot in our forum as well. So if anybody listening hasn't found our forum yet, it's a really friendly, welcoming place where you can go and talk to people who are going through very similar experiences, and people who use the forum really, really value it. So now
it's time.
Limber up.
Yeah. Chair at the ready.
Yeah.
It's ready for it's time for our last session, which is a chair yoga session with yoga teacher Denyse Ritz. Denyse has been practicing yoga for over 30 years and teaching it for the last 8. And she has sort of specialized, I guess, in yoga for people who have sort of mixed ability or might have a health condition that makes normal yoga practice quite difficult. So this is a pre-recorded session. Denyse wasn't able to be with us today, but she has filmed it for us, and it's going to take us through a session focusing on gentle breathing, posture, breath work, aimed at releasing tension and sort of just encouraging relaxation. So you do need a comfortable dining or kitchen chair on a non-slip surface even. And now I'm going to feel like the celebrity on Strictly Come Dancing when they always have to read the T's and C's, because there's a disclaimer.
Oh, right. Pay attention, everybody.
Pay attention. So, as this chair yoga session is online, the teacher Denyse Ritz won't be able to observe your practice. We advise that you don't participate if you've already been advised by your GP to avoid physical exercise or activity. And of course, you should always consult your GP before starting any new program of exercise. We also say that you should listen to your own body, follow the safety instructions Denyse gives, posture modifications or adjustments offered, and gauge the safety of your own practice within your personal physical limitations. If anything starts to feel painful or uncomfortable, stop that movement, maybe stop doing the class, because we unfortunately can't assume any responsibility for an injury that occurs while practicing these techniques. Boring but important bit done.
It's important. You know your body best. Listen to it at all times. But I do hope you enjoy this session. I've been looking forward to it.
Yes, me too.
I missed my yoga class.
You did
this
miss
morning.
yoga this
yeah,
morning.
because
So,
I was coming here. So
a chance to catch up.
Exactly.
Okay, sit back, get comfy and enjoy.
Namaste.
Namaste.
Hello everyone, my name is Denyse and I'd like to welcome you to your chair yoga session for bowel cancer living well. So we're going to start on our chair. Make sure you're seated comfortably towards the front of the chair, so you've got space behind you to get your hands behind you. Make sure the feet are anchored to the floor. So you want to really push down through the feet. And see if you can notice your toes, notice your heels. And then try and imagine that you've got 4 corners to those feet. And see if you can get each of those 4 corners anchored and comfortable. And then making sure your buttocks are comfortably seated on the chair. You might like to draw the flesh away from your sit bones. Sit tall out of your waistline, shoulders away from your ears. Lovely. This is a good starting point for yoga. So yoga is different to other exercise traditions in that we focus a lot on the breath. The breath is really important in yoga. It allows us to relax into what we're doing. It allows the nervous system to begin to soften, so step down again. So we'll start with some gentle, easy breathing practice. So even if you're completely new to yoga, this should be quite doable. So just, if you're able to, close the eyes, or if you'd rather keep the eyes open, just gaze into the middle distance. Try not to see very much. So try not to catch your eye on anything and pay it attention. So in yoga, we tend to breathe through the nose primarily. So give that a go, see how it feels. And if it isn't quite right for you, so sometimes when you're starting yoga, particularly, it doesn't feel quite comfortable. If you'd rather breathe through the mouth, just make it a very gentle, soft breath through the mouth. So just breathing, being aware of the breath as it comes into your body. Being aware of the breath as it leaves your body. And deliberately try and slow that breath down. Making the breath become soft and gentle. Noticing how this feels for you. And it might be a challenge, it might be really natural. Again, just being aware of how things are for you today. And then if you're able to, I'd like you to count your breath in and count your breath out. So I suggest you start with a count of 3 or 4 and don't be in a hurry. So 1, 2, 3, 4 for your in breath, and 1, 2, 3, 4 for the out breath. You just do a couple of breaths like that and see how that makes you feel. For those of you who've done yoga in the past, this probably feel quite comfortable, quite natural. If you're new to the practice, if this is your first taste of yoga, just do the best you can. Try not to fight what we're doing. Try and relax into what we're doing. Lovely. Okay, and then let the numbers go for a moment. Keep the breath soft and flowing and bring your hands to the heart space. So bring the palms together so they're touching, elbows wide. And the next time you breathe in, take the arms up, reaching them above your head as much as you can. And then as you breathe out, open those arms wide. And then breathing in, you bring the arms back up. Breathing out, you bring them back to the heart. We'll do that a couple more times. Breathe in as we reach up. Breathe out as we open the arms out. Turn the palms up if you can. Breathe in, we come back to the center, palms together, breathe out, back to the heart. One more time, breathe in, breathe out, breathe in, breathe out. Just hold the hands at the heart for a moment. If the eyes are still closed, then you can blink them open. Release the hands. Well done. So this session is designed to be very accessible to beginners. So I'll take you through some simple movements, which are designed to loosen the body, release stress and tension from the body. And as I said earlier, just step that nervous system from sort of high level to low level, stepping it down a gear. So it's really important to move the spine. And it's got four main planes of movement. So we'll start by doing a gentle forward bend and back bend. So put your hands on your lap, down by the knees. And as you draw the hands back towards your thighs, you draw them along your leg towards your hips, squeeze your shoulder blades together and push the heart space forward. So push the chest forward, shoulder blades squeeze together, and then push the hands back down towards the knees and roll the shoulders forward. Do that again a couple of times, squeezing the shoulder blades together as you bring those hands back. And as you push the hands forward, you draw the shoulders in towards the center of the chest. So slightly curving the upper back. Squeeze back one more time, really get those shoulder blades active and then push forward and draw those shoulders into the center of the chest. Lovely, carefully uncurl to neutral. Take your arms wide, stretching out. We need to add a little bit of twist into our movement. So let's twist, taking the right hand slightly behind us. So we don't want to go too far. Come back to center and then go the other way. It's really important in yoga, keep this going, to just listen to what your body's telling you. You never push the body into discomfort at any time. So see how this is feeling for you. If you can take it a bit deeper, then please do. But if you need to keep it at that really shallow, light level, that's absolutely fine as well. The important thing is that we're moving the muscles around the spine. Lovely. Okay, and then back to center. Keep those arms up. We'll tip into a gentle side bend. Take the right hand down, the left hand up. So again, you might only be a short way up, or you might be able to go that little bit deeper. Bring yourself back to center. Keep those tummy muscles pulled in, so draw the belly back to the spine. Let's go the other way. Lovely, and back to center. Once more. This is our gentle side bend, just opening up the side of the body. Lovely, and then back to center. Drop those arms and just shake your arms, shake your shoulders a little bit, just releasing tension in the upper back. And it's also extremely important to keep the shoulders mobile. So particularly if we're tense or anxious or we've been poorly, we collect an awful lot of tension around the upper body. So let's practice some shoulder movements. So draw the shoulders up to the ears and squeeze them really tight into the ears. And with control now, bring them back down. So don't just flop them down. We'll do that twice more. Squeeze up, nice and tight. Release down. And again, squeeze up. And release down. Well done. And then there's another set of movements that the shoulder girdle needs to do. So we're going to take our arms out in front of us. I'll turn sideways on so you can see the movement. So keep your hands here for a moment. Imagine you're holding a beach ball in your arms. Keep it there and draw the shoulders back. So we're squeezing the shoulder blades together. The elbows softly bend, and then we reach forward. The beach ball magically disappears. We touch the fingertips together as we curve the upper back. Draw back, your beach ball is there again. So you're squeezing the shoulder blade, your elbows softly bend, and then you reach forward again, the beach ball disappears. We'll do that once more. Beach ball appears, squeeze back, squeeze those shoulder blades together nice and tight, And then we're going to reach forward. Lovely. And release yourself to neutral. Again, give those arms a bit of a shake. Shrug your shoulders a little bit. Moving up to the head and neck. So we create a lot of tension in and around the jawline area. So we'll just do some gentle movements to ease that tension. So sitting tall, make sure your shoulders are away from your ears, so you've got a nice long throat. And we'll cross the arms across the body and push the shoulders, push the head forward and draw the head back. Push the head forward, draw it back. Do that once more. Push the head forward, draw it back. Well done. Bring the hands to the center of the chest and just press in there gently. We're going to try and take the head sideways. This is a great movement if you tend to have a crick in your neck, particularly when you wake up, because it helps the muscles around those top vertebrae. But in my mind's eye, I can see an elegant temple dancer. The reality is something different. So just in your own way, just slide your head from side to side. And what we're trying to do is just move the muscles at the top of the neck. So it might not look terribly elegant and you might find it quite challenging to begin with, but it's a really useful movement to do. Okay, and come back to center. Drop your hands, and then we're going to just take the chin down towards the chest. Bring it back up, bring it up to the ceiling. Lower it down again. The next time we take it back to the ceiling, just squeeze those shoulder blades gently together. We're going to hold the chin up. We're going to stick the tongue out. You're going to stick it out really hard so you can imagine you're licking something off the ceiling. And then release. Stick the tongue out to the right. Again, do it as hard as you can, just for a few seconds, and release. Stick it out to the left. Lovely, and release, and bring the head back down. Turn your head to look over the right shoulder. Back to center, then the left shoulder. Back to center, drop the right ear to the right shoulder. Back to center, left ear to left shoulder. Back to center. Turn your head back to the right and lift your chin, and imagine you're trying to kiss somebody who's leaning over that right shoulder. So you really want to pucker your lips. And release, come to neutral. Turn your head to the left. You've now got somebody over your left shoulder who you really want to kiss. Lift the chin, pucker up, and release back to neutral. Well done. So part of yoga, as I said, is to use the breath and use the movements in the body to relax the nervous system. And one of the best ways of doing that is to learn how to tense and release the body and learn the difference between when the body is tight and when the body is loose. So sit back on your chair a little bit. And we'll lift the legs off the floor. And we'll draw those toes back towards the knees. So you want to really tighten the foot. Try and draw the toes back to the knees. Even if it feels like you're not doing anything, feel the tightness in your foot and release. And then crunch your toes in, squeeze your buttocks, tighten your legs so you feel the whole of that lower body is nice and tight. And then release. Put your feet on the floor. We'll do the same sort of thing with our hands. So spread your hands wide. Really spread them wide as you can go, and then release. And then make a fist really tight and draw that fist up to your shoulders. Hunch your shoulders in, draw the shoulders to your ears, and really squeeze through the upper body. And then release. And then we come to the face and the head. Wrinkle the brow, pucker the nose, grind your teeth together, make the face basically as grumpy looking as you possibly can. Hold it there for a minute and then let it go. Let's do that one more time. Lift those feet off the floor, stretch the feet out, draw the toes back to the knees to begin with. And then crunch your feet under as best you can and squeeze the thighs, squeeze the buttocks, draw the belly in. Hold your breath this time. So breathe in, nice long deep in breath, hold the breath in. And then as you breathe out, let those legs and feet relax. Do the same with the hands. Spread those hands wide. And then make fists and crunch up the whole of the upper body. Draw your shoulders up to your ears. Crunch in. Take a deep breath in. Hold it in. And then sigh it out and let your body relax. Lovely. And then the face. So crunch your face up. Make it as grumpy as you can. Squeeze the eyes. Pucker the nose. Grind the teeth. Furrow the brow. Take a deep breath in. Hold it in just briefly. And then sigh it out and let your face relax. Lovely. Let's do everything together. So lift the feet. Let's spread the feet and hands first of all. And then crunch them in. Tighten the buttocks. Tighten the legs. Tighten the feet, the arms. Draw the shoulders up to the ears. You tie yourself in as big a knot as you possibly can. Really grind, make your face really grumpy. Now take a lovely deep breath in and hold the breath on the inside. And just for a moment, you notice, observe how being tight in your body makes you feel. And then as you release the breath, as you breathe out, take a long sighing breath out and let everything relax. Well done. Wriggle yourself back in your chair. Sit back in your chair, make yourself comfortable, make sure the feet are on the ground, the hands are relaxed on the lap. You might like to turn the hands up. We're going to finish this mini session with a visualization and a little bit more breath work. So just to, hopefully by the end of this, you'll go away from the session feeling relaxed, lighter in mind, body and spirit. So just for a moment or two, I'd like you to return your attention to your breath. Counting the breath in for 4, counting the breath out for 4. Softening the breath, making the breath deliberately as long and comfortable as you can, not forcing the breath, just letting the breath happen. Long breath, steady breath, gentle breath. And then you can let the numbers go and just allow your attention to follow my words as I take you through this visualization. So I don't want you to necessarily see a picture. I just want you to be aware of a sense of the image and follow the sound of my voice from image to image. Try not to analyze, try not to run off in a narrative. Just follow my voice from image to image. A pebble on a beach, a winding country lane, a young tree bending in the breeze, a field of uncut grass, a star in the night sky, a peaceful, gentle, flowing river, a pond covered in ice, a field of poppies in the morning sunlight, a ship sailing across the horizon, an English wood in the middle of summer, the moon rising over high, high mountains, a hawk hovering in the sky, bulrushes at the side of a pond, a water lily opening, cows lowing in the early morning mist, a sea full of waves, a restless sea full of waves, a tall church tower, church bells ringing, the clear blue sky, a hillside covered in heather, a flock of birds flying in formation, rain falling, a little stream trickling, sunlight on a beach, and a clear, wide ocean. A clear, wide ocean. A clear, wide ocean. So bring your attention back to the physical body, dropping the chin towards the chest, blinking your eyes open and gently uncurling your head, and then stretch your arms up, stretch your feet out, great big stretch, take an in breath in, and then sigh the breath out as you release the body. Bring the hands to the heart. Thank you very much. I hope you enjoyed your dip into chair-based yoga. Thank you.
Oh, that was just great, wasn't it?
Oh, just, yeah.
Oh,
it feels wrong to come back and start.
I know,
talking again.
I know. Namaste.
Namaste.
That was absolutely fantastic. I really enjoyed that. What did everybody else think about that?
Yeah, we've got some so goods and some brilliance.
Very relaxing, very relaxing. What a lovely way to end our session together today.
Definitely. And that is the end, I'm afraid. It's been great, hasn't it?
It's flown by.
It has. With Darren and Joanna, Philippa, Robin, and then Denyse there. We've had some amazing speakers. We've had some fantastic questions, and I think we've done a fairly good job at answering as many of them as we could. And as I say, the team will try their hardest to answer those questions we weren't able to answer.
I just want to say a huge and really heartfelt thank you to everybody who's tuned in today. I hope you've enjoyed it as much as you can see we have. We've loved it, but I hope you found something interesting, something to take away from that, and found it useful. And that's teed you up to talk about evaluation and that.
It has, yes. So before you log off and float away, just another reminder that you will receive the feedback survey that we talked about earlier. So please, if you can just spare us another minute of your time to complete that, that would be brilliant. And also that you will then get the link to the recording, that you can then either watch it again, because why wouldn't you want to watch it again? But also you can share it with people perhaps who weren't able to join you today. And then just one final little signpost from me, that of course Bowel Cancer UK on our website have a huge offer of support services for you. Our health information is there to be downloaded on all of the topics that we've covered today and lots more. We have our chat together, peer support groups, which if you're interested in finding out a bit more about, then that information is on the website. We have our online forum and our Facebook groups, where for those of you who've really enjoyed sort of chatting to other people at the same position as you, other people in the same situation understand, then check out our forum and our Facebook groups, and give that a go.
Yeah, absolutely. And maybe if people could just do one more thing in the chat.
Yes. Yeah. If you could give us one word to sum up today, and I won't hold you to one. You can have more than one.
Yeah.
Just so we can have a sense of how today's gone for you. We're going to leave the chat running, but we're going to wish you all a fabulous weekend, and say our goodbyes.
Yes. So thank you so much for joining us. Enjoy the chat, and I hope we'll see you again soon.
Absolutely. Take care,
Take
everyone.
care.
Bye.
Bye.